Good evening, everyone. Welcome to the Grahya National Seminar Paper and Poster Presentation. I would like to invite Dr. Aishwarya as Paper Coordinator. Hello, Dr. Aishwarya.
Thank you, Dr. Good evening to one and all. Welcome to Grahya National Level Paper and Poster Presentation presented by Team Ayurapta. And first of all, thank you for joining us. Before get start, once again, I warmly and respectfully welcome our honorable faculty members. And I'm not adding much more. First of all, we'll have a paper presentation by our PhD scholar, Dr. Divyamol. I invite Dr. Divyamol MD for the paper presentation.
Thank you, Doctor.
Good evening, Doctor.
Good
Doctor,
evening.
please share your screen.
Yes, sure. Is it visible now?
Yes,
Yes,
Doctor. Visible, Doctor.
Okay. Shall I start now?
Sure, Doctor. Please start, Doctor.
Okay.
Doctor.
A very good evening to the respected panelists, the organizing members, and all co-presenters. Myself, Dr. Divyamol MD, currently doing my PhD in first year, going to present a case report. Sorry for the inconvenience. Can I hide this panel? Okay, thank you. Once again, myself, Dr. Divya, I am going to present a case report on an effective approach through Ayurveda in the management of urinary inconvenience, a case study. Coming to the patient profile, she was a 38-year-old, married, moderately built, multiparous woman, and her chief complaints were urine leakage associated with a sudden compelling desire to void urine and increased frequency of urination along with pelvic pain of 3 months. Also, she was experiencing low back ache for 1 week. A slight aggravation of her symptoms was noticed during the menstruation, and voiding of urine gave her some relief for a short period. And there were no relevant findings regarding her family history or past medical history. And she was not under any medication, or she was not a known case of any medical illness or comorbidities. Coming to her menstrual history, her cycles was regular on every 28 to 32 days with a duration of 5 to 6 days and along with moderate pain and average menstrual flow. And dyspareunia was present. The patient was multiparous and with all normal vaginal deliveries. The bowel was constipated and she was experiencing a decreased appetite. The complaints of the patient regarding bladder habits include increased urgency and frequency of urination. Alongside, she was experiencing involuntary leakage of urine in association with coughing and sneezing. Bladder discomfort was also present there. Coming to the examination part, she was with a moderate build and an averagely nourished body, and slight pallor was present. And there were no definite findings regarding her cardiovascular system, respiratory system, or the central nervous system. When coming to the gastrointestinal system, on abdominal palpation, a slight tenderness was present in hypogastric and suprapubic region. On pelvic examination, tenderness over the urethra was present. Next, we proceed to the bimanual pelvic examination findings of the patient, and it revealed a tenderness over the anterior vaginal wall. Coming to the laboratory investigation, her HB level was 11.2 gram per deciliter. Blood glucose level was within normal range. Complete urine analysis and urine culture along with sensitivity test were normal. Ultrasound of lower abdomen and pelvis was performed and not detected any abnormalities. Her cystoscopic findings suggested post-distension glomerulation and reduced bladder capacity, which was an important finding in this patient. Coming to the Dashvida Parisha part, her Prakriti was Vata Pitta predominant with Vata Pradhana Tridosha Vikriti. Her Sara, Samhanana, Satmya, Sattva and Vyayama Shakti were of Madhyama Avastha and Vaya in the Madhyama Kala. Her Abhyavagarana Shakti, Jarana Shakti and Pramana were of Avara classification. For diagnostic assessment, we used a bladder diary, cough stress test, and international consultation on incontinence modular questionnaire, that is UA short form 6 questionnaire. A 3-day bladder diary was established before starting the treatments, and after completion of it, it is used as a pre-therapy diagnostic tool and post-therapy outcome measure. Cough stress test and international consultation on incontinence modular questionnaire were used to assess the morbidity both before and after the treatments. Therapeutic intervention. After initial assessment, the patient was administered with Ayurvedic medicine for a period of 6 weeks. These were the medicines: Chandraprabha Vadi, Vishathindu Vadi, Srimudhi Sagar Ras, and Ashwagandha Churna. Chandraprabha Vadi in the dose of 500 mg twice a day after food with water. Vishathindu Vadi 65 mg thrice a day after food with water. Srimudhi Sagar Ras 250 mg twice a day after food with water. Ashwagandha Churna 3 gram twice a day after food with milk. Follow-up and outcome. There were 3 follow-ups during the whole course of treatment, in which the first 2 were in a gap of 21 days and the last one was after 1 month of stoppage of medicines. Considerable remission of signs and symptoms were noticed from the first follow-up itself, even though the medicines were continued for 21 days more. After stoppage of the medicines, the patient was on observation for 1 month, and during which she did not take any medicines but followed all Patya and Apatyas. The outcome assessment, which are ICU-IQ UA SF index and cough stress test and bladder diary. The ICU-IQ UA SF index was 13 before treatment and 4 after treatment. The cough stress test was positive before treatment and negative after treatment. Bladder diary showed urine leaks in small amount and urgency in moderate amount before treatment, and urine leaks nil and urgency mild desire after treatment. Coming to the discussion part, urinary problems are very common in women and which highly demands management in regular practice. Its underlying cause varies from a very complicated one to a comparatively manageable one. Any deregiments to the Mutravaha Srotas will cause symptoms such as urination associated with pain and voiding of too much of urine. The condition requires a chikitsa which covers both the Vata Vikriti as well as Mutrasya shock. In this patient, the treatment was given for a period of 42 days. Medicines were included both herbal and mineral preparation, because sometimes the mineral preparation shows a speedy recovery. The first medicine was Chandraprabha Vadi, which shows a multidimensional action and shows specifically its action on Mutravaha Srotas. And it is Kadurasa and Ushna in Virya with Vishuddha and Sushma Gunas, which brought its action on Smushma Mutravahi Swaras more effectively. Most of the drugs in this preparation have Shulagna and nephroprotective action, as it is effective in Mutrakrisha, Mutrakata, and Ashmiri Roga. Coming to the second medicine, that is the Vishathindu Vadi, pacifies Kapha-Vata originated diseases, and it cures Vasti Shaidilya, thereby reducing the symptoms such as urinary urgency and increased frequency of urination. Ashwagandha, which is a single drug having Laghu and Srigda Guna as well as Rasayana and Belly Karma, which are contributed to the improving the tone of the bladder in this particular case. Smriti Sagar Rasa mainly act on the Manavaha Srotas, which is a Kadurasa Pradhana medicine with the Vevai Guna and properties such as Aksheba Shamana and Belya, which has shown its effect by normalizing the rearranged Vata here. It also elevated the anxiety of the patient as it is having properties like Medhi and Sajnastabana. Conclusion: urinary incontinence is the inability to hold urine voluntarily by the person. First line of management of such concern includes lifestyle and behavioral modifications with pelvic floor exercises and bladder training. In maximum cases, the management of such condition requires a peaceable but effective solution and which push the patients to seek alternate system of medicine for the same. This case was managed with easily available and minimum number of medicine in less duration, which makes the treatment more effective and acceptable for the treatment. Thank you.
Thank you, Dr. Divyamol. Next, I invite Dr. Sadika Prashant Chavan for the paper presentation. Dr. Sadika, are you there? Hello, Dr. Sadika, are you there? Hello, Dr. Sadika Prashant Chavan, are you there? Dr. Sadika, we can't hear your voice, doctor. Please reconnect your headset. We can't hear your voice, doctor. Doctor, we can't hear your voice, doctor. Please reconnect. Please connect your headset or reconnect your headset, doctor. Topic of Dr. Sadika Prashant Chavan is basics of Snehan under the Panchakarma panel. Sadika, can you hear me? Sadika, can you hear me? Your voice is not clear, doctor. We can't hear your voice, doctor. We can't hear your voice, doctor. Okay, don't worry, Dr. Sadika. We will call you next, doctor. Next, I invite Dr. Meghavi Kharde for the paper presentation. Dr. Meghavi, are you there? Hello, Dr. Meghavi Kharde, are you there?
Yes, sir, I'm here.
Okay, doctor, please share the screen, doctor.
Yes, sir.
Topic of Meghavi Kharde is Dinacharya, a scientific approach to prevent the non-communicable diseases under the Sasthavata panel.
I'm audible, sir.
Yes, Dr. Orwell. Please share your PPT, doctor.
Yes. Screen. I-
Dr. Mekhavi.
Sure. Actually. Hello.
Doctor. Your screen is sharing, doctor. Yes, doctor. Now visible, doctor. Please
Am
turn
I
on your
visible, sir?
PPT, then start, doctor. Your screen is visible, doctor. Please turn on your PPT, doctor.
I'm
Yes, now
visible,
visible,
sir.
doctor. Yes, doctor, visible.
Okay.
Please start, doctor.
First of all, good evening, everyone. Myself, Meghavi Ghade, PG Scholar, Swastha Rutta Department, Vidarbha Ayurveda College, Amravati. I'm presenting the paper entitled as Dincharya, a scientific approach to prevent non-communicable diseases. Abstract. Ayurveda is not only a medical science, but also it is a science of life. It not only gives prominence to cure of the disease, but also preventive measure. Dincharya, that is the practice of daily routine, has been described as the correct sequence of routine one should follow to get healthy life. When we follow Dincharya as per Ayurveda, lead to balance, three dosha, and is directly affect the biological clock and the circadian rhythm of the body. Well practiced Dincharya result in balance between Trayopastambha, which synchronize with Dhatu portion, and Oja formation, which improved our immunity. Introduction. A non-communicable diseases that is not transmissible directly from one person to another. A combination of genetic, physiological, lifestyle, and environmental factor can cause these diseases. According to WHO, four main type of non-communicable diseases are cardiovascular disease, chronic respiratory disease, cancers, and diabetes. Non-communicable diseases are leading cause of death globally. From them, non-communicable disease kills 41 million people each year, about 70% annually, followed by cancer, 9.3 million, respiratory disease, 4.1 million, and diabetes, 1.5 million. Disease prevention has gained popularity in the recent year due to the financial and health implication reason. A study suggests over medicalization for coronary angioplasty, angiography, LSCS, knee replacement surgeries, excessive use of painkillers, unethical use of antibiotics increase the risk factor of non-communicable diseases. Ayurveda describes the way to prevent the risk factor of non-communicable diseases in the form of proper dietary management, dinacharya, rutucharya, panchakarma, and rasayan therapy. Aims first to study the role of Ayurveda in prevention of non-communicable disease. Second, to study the effect of role of Dincharya in prevention of non-communicable diseases. Objectives: to study the effect of Dincharya Upakram to prevent non-communicable diseases. Second, to study the detail of Dincharya literature. Third, to study the detailed information of non-communicable diseases. To study the preventive measure for non-communicable diseases. Material and method. A review of literature, classical Ayurvedic textbook, and conventional medical science books was done to explore aspects related to Dinacharya. Search engines of Google Scholar and PubMed were explored using keyword Dincharya and non-communicable diseases. Third, various article review through net surfing and hand search. This article was then critically reviewed, analyzed, and information used to present matter systematically. The scientific aspect behind this Dincharya Upakram, their relevance to health, disease condition, and their role for prevention of non-communicable diseases can be explained as, first of all, the Brahma Muhurat Jagran. Waking in the morning before dawn, that is Brahma Muhurat, after assessing the digestion of previously consumed meal is advised in daily regimen. Due to the Vata dosha dominance in this period, it is advised as the appropriate timing for leaving the bed for proper synchronized physiology and circadian rhythm of the body. Second, Purush Vega Vidharana. Early morning is a proper time for defecation for body physiology due to dominance of Vata dosha, which is responsible for Mala Utsarjan. Delay in raising in bed, postpone defecation, suppress natural urge, later it requires straining for stool passage, resulting constipation, piles, and other anorectal diseases. Third, constipation is also linked with the risk factor for a cardiovascular diseases. Third, Abhyanga and Vayam. Inactivity is one of the major lifestyle components recognized as risk factor for non-communicable disease. Massage and Vyam are important dincharya upakramas. Various studies conducted on massage and its beneficial effect that body massage is useful to reduce stress, improve muscle tone, body immunity, and also has immunomodulatory effect. Vyam has numerous body-mind benefits like weight loss, maintain blood pressure, type 2 diabetes, prevent osteoporosis, lower stress, strengthen muscle, bones, and joints. Excessive Vyam are deleterious to health and causes several diseases. Thus, using Ayurveda principle of individualization according to the person's strength, Ardha Shakti Vyam is advised. And Sandhya, worshipping and prayers. The positive effect of prayer are scientifically documented. Ayurveda lifestyle offering prayers to elders increase sattva guna of person, increase the social acceptability of person, ensure companionship, trust, love, which are positive psychological factors. Poor social and personal relation increases stress, pro-inflammatory cytokine activity, which are risk factor to the non-communicable diseases. Then Ahar. That is the first pillar of the health. Ayurveda ascribes the intake of healthy diet, wholesome diet, Tadarasatmak diet as per individual appetite and digestive capacity according to the Agni of the patient. The food should be consumed following guidelines of Ashtavidhi, Ahar Visheshtayan and Dwadashana Pravichar. Improper amount of food and unhealthy food are risk factor for non-communicable diseases. Then Vritti, that is earning money and having an occupation. Ayurveda states that the leading a life without a proper mean of vritti, that is livelihood, is a sin. Artha is one of the four ultimate goal of life, Purushartha Chatushtaya. It is the main source to attain personal as well as social satisfaction. Grita evam darpan darshanam, looking own face into the ghee or mirror, is no increase prolongs longevity, avoids mental confliction. Ushna Jalapana, 1-2 glass of water kept for whole night should be taken before sunrise. Not drinking enough water in a day is also triggering factor for the renal stones, hemorrhoids, and constipation. Ushna Jalpan also prevent old age diseases. Achmana, Mukha Netra Prakshalana, washing of face and eyes. To wash, which will be done after cleaning the excreta, tear, sneezing, and after traveling to prevent the eye diseases. Jiva Nirlekhana, tongue cleaning. Tongue should be cleaned by a long flexible strip of metal or a plant material. Removes the impurities of tongue. It will benefit in bad odor of mouth, cure edema, and gives taste. Nowadays, those metal are very costly, so that we can use at least steel items. According to the acupuncture theory, tongue has many more acupuncture points which initiate the proper functioning of vital organs like liver, kidney, bladder, stomach, intestine. Neha Gandusha Dharan, retaining oil in mouth, prevent asya, kantha shosha, prevent cracking of lips, makes the teeth healthy and strong, and enables them even to chew the hardest eatables. Dishu Koshna, that is lukewarm gandush, and Kaval Dravya are used, which improve the circulation of oral cavity. Gargling procedure of Kaval causes the massaging effect over the oral mucosa and strengthen the muscle of cheek, face, and jaw and bones. Chakraman. It is a variety of exercise which does not cause any kind of trouble to the body. It clears the channels, that is throats of the body, and increase the perceptive power of organs. Udavartana. By doing this, blood vessel become dilated and complexion in the skin is enhanced. Cure rashes, vata diseases, enhances the strength of thighs and provide the lightness. Dhumapan, that is medicated fume inhalation. Prevent Jatru Urdhva Gata Roga, which can caused by Vata and Kapha. It strengthens the voice and also prevent premature graying of hair. When the Dhumapana Dravyas are lighted with fire, it releases the smoke, soot, and even CO2. Carbon atom in CO2 has tendency to stimulate the respiratory center present in the brainstem, which may trigger the normal physiological function of respiratory system. Disinfective action of Dhumapana, Dravya like Haridra, Guggur, Vacha, cleanses the respiratory tract and oral cavity and pharynx. Snana, bath. Daily bath improves enthusiasm, strength, appetite, removes sweat and other impurities from body, promotes virility, longevity, eliminates fatigue, sweat, dirt, increase body strength. Bath stimulate digestive fire, increase span of life, that is Ojavardhak and strength. It also removes itching, dirtiness, fatigue, sweat, thirst, etc. Samavahana, gentle massage enhances the affection, sleep, virility, avoids the kapha, and also improves the circulation. Then next, Nidra or sleep. 7 types of Nidra have been mentioned. Out of the Ratri, Swabhavaja is considered to be conductive to the health. Night sleep causes happiness, nourishment, strength, virility, and vitality, and also bring Dhatu Samyata. Balance body constitute, promote good vision, complexion, and improve digestive power. Healthy sleep can helps you better regulate blood sugar levels, keep your immune system functioning and properly. Your heart health by decreasing the stress. Then discussion. Non-communicable diseases are the main disease burden globally. Lifestyle is a major factor for non-communicable diseases. Industrial revolution and the technological advancement with packed food, frozen food have greatly affect lifestyle, causes deterioration of the health. Comprehensive lifestyle can also reverse the progression of the disease. The aim of Dincharya, according to the Vagbhata, is now we will discuss all activities which can be done constantly by the healthy person having desire of preservation of the health. Maintaining hygiene is an important component of Dinacharya with the practice of Dantadhavan, Jiva Nirlekhan, Mukha Netra Prakshalan, Kaval Gandus, Snan Nashya, Nirmal Vastra Dharan, Ratnamala Dharan, and Shaur Karma. Timely defecation is a major regular cleansing gut from metabolic waste which is retained can predispose several diseases through the development of Udavarta and Purusha Avritta Vataha. Quality night sleep is essential for a proper body growth and maintain body homeostasis. Natural synchronized human body physiology to the mother nature through various biological clock called chronobiology. Ayurveda recognize the effect of chronobiological cycle and advise seasonal and daily regimen schedule. Ayurveda, due to the inherent principle of health preservation, can play important role to prevent non-communicable diseases. By practicing Ayurveda daily regimen, prevention of disease before they arises in healthy individual that decreases the incidence of the diseases, reduces risk factor for non-communicable diseases, improving immunity, reduces disease progression and complication of disease, resulting decrease in mortality rate due to the non-communicable diseases. As shown in the diagram, the daily lifestyle activities affect the autophagy and its health benefits. Due to the following of the Ayurvedic Dincharya regimen, the health benefits such as improved blood sugar levels, weight loss, neuroprotection, genomics integrity, hemostasis, regulation of inflammation, cell repair, immunity, longevity, inhibitions of cancers, improvement of intellectual facilities. Then, in this diagram, circadian clock regulating physiological activities in coordination to the Ayurveda daily regimen. It shows that the circadian clock having regulating physiological activity correlation with the Ayurvedic daily regimen. The next conclusion, non-communicable diseases are the biggest global burden in today's area. Non-communicable diseases are strongly influenced by 4 main factors: insufficient physical activity, unhealthy diet, harmful use of tobacco and alcohol. These are many interventional described in Ayurveda for purpose of health promotion, which can also be applied to prevent non-communicable disease. Dinacharya, Rutucharya, and Trayopstamba are main control tool to maintain health. Non-communicable diseases which are associated with poor lifestyle choices, including unhealthy eating habits, physical inactivity, poor sleep, and disturbed biological clock, can be addressed significantly with these daily regimen practices of the Ayurveda. These are my references. And last slide. Thank you.
Thank you, Dr. Meghavi Khade. Next, I invite Dr. Darshan Balakrishna Samalkar for the poster presentation. Dr. Darshan Balakrishna Samalkar, are you there?
Good evening, sir.
Good evening, doctor.
So can you share my poster?
Okay, 1 second, doctor. I'll share for you. One second, doctor. Doctor, please start the session, doctor.
Uh, can I start, sir?
Sure, doctor. Please start, doctor.
Good evening, everyone. Myself, Dr. Darshan Balakrishna Sarmarkar, from final year. I'm a final year MD student from Kai Chikitsa Department, SMBT Ayurveda College and Hospital, Nashik. Today, I'm going to present the topic that is the understanding and management of respiratory diseases in Ayurveda. That is CAS. Classical Ayurvedic medicine categorize respiratory challenges into two main categories, that is Kasa and Shwasa. Now we are going to see the poster of regarding the information about the Kasa disease, which includes the causes. The causes can be correlated with the Apatya Ahar and Apatya Vihar both. The Apatya Ahar causes are that Vishtambi, Vidahi, Ruksha Anna, Matsya Sarshapa, तुम्बी फल उपोदिका दुष्ट अंबु विरुद्ध अन्न गुरु शीत अन्न payodadi pishtanna payasa and guda kept for more than 4 years. Now we can see that in the apatya vihar, basti nasya raktamokshan vyam danta gharshan atab dushta pavan rajo marga sevan shakruta mutra udgar kasava Vaba Vegadharan, Maithun, and Divaswa. Now we can go towards the Purvarup. The symptoms of the kasas are correlated with the common cold, such as the sore throat and decrease in appetite. Now we can see the types of kasas are Vataj, Pittaj, Kafaj, Shataj, and Shahad. So according to the types, we can look for the Rupas, that is Vataj. It has a minimal mucus, hard mucus, and gray in color. In case of Pittaj, it is moderate mucus, sticky and yellow in color. In case of Kapach, it is in large amounts of mucus, sticky, cloudy, and white in color. In case of Shataj, symptoms related to the Vatas, Pittas are there. It has an abundant mucus with fever and going of pigeon-like cough. In case of Shayash, occurs with the wasting disease such as tuberculosis. This condition is Sannipathic in nature. Sannipathic means it has all the three doshas characteristics in it. Now we can go towards the informative about the comparison between the types, that is Vatas, Pittaj, and Kafaj Kas. In case of now we can see about the Samprapti, that is Kas occurs when the Apan Vayu is obstructed, resulting in an increase in upward motion. Vitiation of Udan Vayu propels in the air upward and out of the body. Vata may, however, lodge in the chest, back, or head, resulting in pain and repeated coughing. The comparative studies that Vataj cast pylation therapies plus balm or moist expectorant herbs like Kantakari, Vasak, licorice, and wild cherry bark. In case of Pittaj cast, we can use moderate purification plus cool expectorant herbs, that is Vansa, Lochan, licorice, and mullein. Antimicrobial herbs like Kutki, Neem, and gold seal. In case of Kafaj Kas, strong purification plus dry or hot expectorant herbs like bayberry, kantakari, clove, black pepper, and eucalyptus can be used. The sadhya sadhya of the disease is that doshic disturbances resulting in Kasa are relatively easy to treat, with Vataj considered the easiest and Kaphas the most difficult. Those of the mixed dosha pathology such as Shataj types are more difficult. Shayaj Kas is the most difficult of all. Ayurvedic text states that the Kasa of any kind, if not treated properly, can progress to Shaya type. Now we can see the treatment of Kasa, that is Patya. First, we are going to see the Vata Kasa. In its Aushad, we can use Dadimba Churna in quantity of 2 pal plus Guda 8 pal and Trikatu 3 pal and Trishugandhi for 1 pal. Then in second, Kantakari, Kasamarda, Jivanti, Draksha, Bimbi, Matulunga, Pushkar, Vasa, Sushma Ila. These are the drugs which we can use. In case of Ahar, we can use Kulatta Rasa Dhawan, Mansavartak Gomutra, Lasun, Haritaki, Trikatu, Ushnodak, Madhu, Laja, Lagu Anna, Amlaki, Churna with Sheer and Grit. And the therapy which can be used in case of Vata Kas is Divas Nidra, that is Divaswap. Then in second, that is Pitta. For a Pitta Kas, the Aushad can be used as Draksha, Madhuka, Amlaka, Kharjura, Pipli, Marich with Grita and Madhu. In second, we can use Padma Bija Churna with Madhu. And third, Satapasta Gruta, that is Mahisha, Gokshira Gruta, and Amlaka Yush. In case of Ahar, we can use Vastuka, Vayasi, Shaka, Mulaka, सुनिष्क स्नेह तेल इक्षुरस गुड दधी अर्नाळ आम्लफल प्रसन्न मधुर आम्ल लवण रसात्मक आहार ग्राम्य अनुप उदक मांस शाली यव गोधूम षष्टिक माश जांगल रस शामेक यव कोद्रव मुग्धादि युष. In case of therapy, virechan therapy is used in Pittach Kasa. In Kafach Kas, the Aushad which is used are Shunti Swaras with Madhu, Navanga Yusha, that is Mugda, Amlaka, Yava, Dadimba, Karkatandu, that is Bear, Shushka, Mulak, Pipali, and Kulatta. The Ahar which is used in Kafach Kas is Sura, Puran, Sarpi, Chakpayagrita, Ushnodaka, Madhu, Laja, and Lagu Anna. And the therapy we can use is Swedan. This is about the understanding and management of respiratory disease in Ayurveda. That is CAS. Thank you, sir.
Thank you, Dr. Darshan. Next, I invite Dr. Snehal Dekhunath Mitkari for the paper presentation. Dr. Snehal, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Okay. Is it visible, sir?
Yes, doctor. Visible, doctor. Please chat, doctor. Please start the session.
First of all, good evening, everyone. I'm Dr. Snehal Raghunath Mitkari, MS Chalatadra Scholar from SVNST Ayurveda College, Rahuri. My topic for paper presentation is effect of Ayurvedic treatment on ulcerative colitis. Abstract. Ulcerative colitis is a chronic idiopathic inflammatory bowel disease with a relapsing nature. It is very challenging disease affecting a patient during the most active period of his life, that is 20 to 40 years of age. The main features are anorectal bleeding with increased frequency of bowel evacuation, general debility, and with abnormal structural pathology in the descending colon, particularly sigmoid colon. In modern medical science, there is no permanent curative and safe treatment for this disease. This study can be helpful for reducing need of steroids and surgical processes in patient of ulcerative colitis. A clinical study on patient of ulcerative colitis has been conducted at OPD and IPD of SVNST College. It had a patient had given Udumbar Quat Basti with oral medication including Kutaj Ghanavati, Udumbar Quat, combination of Musta, Nakeshar, Lodra, Mukta Panchamrut Ras, which includes Mukta Bhasma, Pravar Bhasma, Vanga Bhasma, Shankha Bhasma, and Sautik Bhasma for 1 month. Results were analyzed. In this study, it was observed that the symptoms and signs were reduced by more than 75% with a highly significant result, and the hemoglobin level was also increased. Introduction. Ulcerative colitis is a chronic inflammatory bowel disease. Its incidence is more during 20 to 40 years of age, and 5 to 10 per 1 lakh persons are at risk. Bleeding in stool with increased bowel frequency are the main feature of this disease. Weakness is more common due to loss of water and blood in stool. In conventional Western medicine, some drugs like sulfasalazine may give mild relief in symptoms and signs, but after some time, patient need more doses and of same drug. Some patients get benefit with steroids, which again
are not suitable because of their side effects. Even after taking steroids and sulfasalazine, the patients suffer from the disease. So patients are always seeing some alternative therapy promising more effective and safer outcome. The author found some encouraging result in patient of ulcerative colitis with certain Ayurvedic treatment. The treatment significantly corrected bleeding in stool and bowel frequency, which are the main feature of ulcerative colitis. In addition, the treatment also improved the general condition of patient. Ulcerative colitis is a disease of Purishva Strotas. In Ayurveda, Raktatisar is mentioned as advanced stage of Pittatisar. Pichavasti also mentioned as a management of Raktatisar in Charak Samhita. This disease can be correlated with ulcerative colitis. Aims and objective. The aim and objective of this study were as follows: to prove the efficacy of Ayurvedic treatment in the management of ulcerative colitis, to provide a large population suffering from ulcerative colitis a further possibility of safer treatment. This can be helpful in reducing the need of steroids and surgical process. Material and method. This is single case study. A case report of 34-year-old patient came with a complaint: pain in abdomen, blood in stool, loose motion, fatigue. Patient done colonoscopy study outside the institute. A symptom of ulcerative colitis are seen. Patient was taking drug, prednisolone and sulfasalazine. No any associated major illness seen. No any complication like fistula seen. Plan of study and treatment. Proforma compiled with detailed clinical history and physical exam of the patient. Investigation like HB in Rampursen, ESR, stool routine, microscopic and colonoscopy. After confirming the diagnosis, patient was given the following treatment: Odumbar Quath, 40 ml per 40 ml 2 times a day. Lodra Churna, Musta Churna, Nagkeshar Churna, and Mukta Panchamrut Ras combination. Kutaj Ghanavati and Udumbar Kwat Basti daily for 1 week and then twice a week for the next 3 weeks. This treatment was given for a study period of 1 month. Pathya Patients were kept on Pitta Shamak, Laghu, Grahi, and Pathya food particles. The patient was taking modern medicine. Doses of these were gradually reduced as the patient responded to Ayurvedic treatment. Criteria of assessment. The improvement in the patient was assessed on the basis of relief in symptoms and signs of the disease together with laboratory investigation. All the symptoms and signs were given grade scores and assessed before as well as after treatment. Changes in hemoglobin, ESR, and body weight were also recorded before and after treatment. Reduction in the doses of steroid and sulfasalazine drug were also recorded. Effect of Ayurvedic treatment on sign and symptoms. Before treatment, the bowel frequency is 5 to 7 times per day. After treatment, it reduced to 1 to 2 times in a day. Blood in a stool, bleeding daily and 4 to 8 times in a day before treatment, and after treatment is occasionally bleeding. Abdominal pain before treatment is more moderate, and after treatment there is no pain. Weakness, severe weakness before treatment. After treatment there is no weakness. Body weight gain up to 1 kg. Effect of Ayurvedic therapy on investigation of patient. Hemoglobin is increased by 0.1 gram. ESR reduced, RBC reduced, and pus cells in stool reduced. Probable mode of action. Probable mode of action of a therapy ulcerative colitis is a disease of Purishva Strotas, which is caused by Pitta Pradhan Vata dosha. Udumbar Quat has properties of Pitta Vata Shamak and also Vrana Shodhan and Ropan, which help in healing ulcer in the colon by Basti Karma. It is also a Stamban property that help in reducing the bowel frequency and check bleeding. Kutaj Ghanavati contains Ghana Sattva of Kutaj Twak and has a Atisar Nashak Guna that also help in reducing the bowel frequency. Musta with its Grahi action relieves the ama in the body and also reduce the bowel frequency. Nagkeshar has Raktatisara Nashak property Lodra has Raktastambhak action that stops bleeding. Mukta Panchamrut Ras is a classic compound Ayurvedic drug that relieves excessive Pitta dosha and Ushna gun in a body. One of the ingredients of Mukta also relieve mental stress, which is contributing factor to the disease. Discussion. As it is important to give break to the recurrence of this disease, this study is helpful, and we have seen the changes of condition of patient before and after Ayurvedic treatment. Mostly symptoms are reduced. Conclusion. On the basis of clinical observation and discussion, it may be concluded that ulcerative colitis was found in middle-aged people between 20 to 40 years of age. The result obtained may be attributed to the disease modifying effect of trial therapy by means of its antipitta, pranashodhan, ropan, grahi, and stamban properties. All the signs and symptoms were reduced by more than 80%, and the reduction was highly significant. RBCs in the stool, which is the main clinical sign of this disease, was reduced. Hemoglobin increased by 1.1 gram percent. The dose of steroids was reduced. All the results were highly significant. The trial therapy is an ideal drug as a safe and effective alternative in case of ulcerative colitis. These are the references I have taken. Thank you.
Thank you, Dr. Snehal Tagunatkarri. Next, I invite Dr. Soumya PT for the paper presentation on the topic concept of Viruddhahara. Dr. Soumya, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Okay. Is it visible, sir?
Yes, doctor. Visible, doctor. Please start the session.
Okay. Good evening, all. I am Dr. Savya PT, final year PG scholar, Department of Agriculture, KBG Ayurveda Medical College, Sulia. My topic is concept on Viruddhahara. Here are some references about Viruddhahara. First of all, the first reference was from Charaka Samhita Sutrasthana, 28th chapter. The chapter name is Vividha Ashita PDM. First loga was Ahara Sambhavam Vastu, Rogasya Ahara Sambhavaha, Hidahida Visheshascha, Vishesha Sugadukayoho. Next reference was Yet Kinshit Dosham Astravya. Yet Kinshit Dosham Astravya, Na Narharet Kaidaha, Ahara Jada, Tat Sarva Mahida, Ahida Yo Padyate. The next reference was from Ashtanga Sutrasthana 7th chapter. Yet Kinjit Dosha Mutkesha Na Hare Tat Samasadaha Viruddha. It means Viruddha is that things which cause aggravation of dosha but does not expel them out of the body is the Viruddha. Coming to introduction, Agdadandra is one among the 8 branches of Ayurveda which deals with the diagnosis and management of various poisonings of both Stavra and Jangama. This branch of Ayurveda also deals with various Ahara Vishas. Viruddha Anna or incompatible diet is very important issue discussed by ancient Ayurveda acharyas. It is said to be the cause of many systemic disorders as per Ayurveda. Persons who consume Viruddha Ahara are prone to many disorders. In Ayurveda classics, Ahara is mentioned as one among the 3 Bhastambhas, that is the 3 Trayobhastambha are Ahara, Nidra and Brahmacharya, which supports the body. Ayurveda clearly mentioned regarding the wholesome and unwholesome diet and the merits and demerits of such food for healthy living. Ayurveda emphasizes on consuming right kind of diet which is healthy and nutritious. The Dravya causes adverse effects of Sharirika dosha and Dadu is called Vairodhiga, and Viruddhahara is referred in terms of food and food-to-food interactions or food processing interaction develops toxicity. In Charaka Samhita Sutrasthana, 26th chapter, that is chapter name is Atraya Bhadragapya Madhyayam, Charaka Acharya defines 18 types of Viruddhas. They are Desha Viruddha. Desha Viruddha example is human in Jangla Desha having Ruksha Tikshna Dravyas. Kala Viruddha, Shita and Ruksha food in winter season. Agni Viruddha, intake of Guru Ahara in Mandakni. Matra Viruddha, honey and Viruddha in equal quantity. Satme Viruddha, use of Madhura Shita food for a person who is accustomed to Kadushna food. Dosha Viruddha, use of diet, drug and behavior similar to dosha properties but adverse to the person's practice is opposite to doshas. Samskara Viruddha, cooking peacock on air and a stick or with air and a taila. Virya Viruddha, Shita Virya and Ushna Virya combined together. Koshta Viruddha, Tikshna Aushadha for Mrudu Koshta. Avastha Viruddha, after Vada Vardhaka Kriya, having Vada Vardhaka Bhojana. Krama Viruddha, without emptying bowel and bladder before food. Parihara Viruddha, Ushna after eating pork. Upachara Viruddha, cold things after eating ghee. Paga Viruddha, preparation of food with bad or rotten food. Samyoga Viruddha,
Hello, Dr. Soumya. Hello, Dr. Soumya. Can you hear me? Hello, Dr. Soumya. Can you hear me? Okay, next I invite Dr. Surabhi P for the paper presentation. Dr. Surabhi, are you there?
Yes, sir. Yes, sir.
Okay, doctor, please share the screen, doctor.
Okay.
The screen is visible, doctor. Please start.
Okay, sir. Good evening, all. Myself, Dr. Surabhi P, a final year PG scholar, Department of Agadandra, KVG Ayurveda Medical College Hospital, Surya. My topic is Arishta Bandhana in Vishwa Chikitsa. Introduction. Agadandra is one among the Ashtangas of Ayurveda. It is a branch in which explains treatment of various poisons. Arishta Bandhana is the second Upakrama mentioned in Chaturvimshati Visha Upakrama. Arishta Bandhana is very important treatment, and this is done to avoid the spreading of poison. Arishta Bandhana can be bound with mantras by the expert in them. Few references of Arishta Bandhana we can get from Sushruta Kalpa 5th chapter, that is Sarpa Dashta Vishwavignaniya Kalpa, and from Charaka Chikitsa 23rd chapter, that is Visha Chikitsadam Adhyayam, and from the Ashtanga Sangraha Uttara Tantra 42nd chapter, that's Sarpa Visha Pradisheda. From Arishtamavi Mandreshcheva, Bandriyat Mandra Kovidaha. Here, with the mantra, the Arishta Bandhana can be done. And Damshastu Visham Dashtad, Visridam Venigabis Veniga told instead of Arishta Bandhana. And according to Ashtanga Sangraha, Bandho Deshanusarena Shofadin Kurude Hrudipedidaha Ashaktaha Shidilo Rodhum Visham Deshandaram Vrajet. Depending upon the nature of the Desha, Arishta should be Nadi Gada, Nadi Shitila. If Adipadida, Adipedita, it causes Puditva of the body part or shofa at the site of damsha, it will cause shitila. The Arishta fails to prevent spreading of visha to other deshas. Arishta Bandhana is one of the emergency management for Vishajanya Rogas. Arishta Bandhana should be applied 4 angula above the site of bite. According to Acharya Chakrapani, Arishta Bandhana is of 2 types, tying ligature with mantra, tying ligature without mantra. According to Acharya Sushruta, Sarve Revadida Sarpa, Saga Dashtasi Dehina, Damshasyobari Bandhiniyad, Arishta Chadurangula, Ploda Charmanda Valkana, Mruduno, Anyata Menavai, Nagachadi Visham Deham, Arishtam Abhinivarida. This is from the Sushruta Kalpa 5th chapter, Sarpa Dashta Vishwavignaniya Kalpa. If bitten in shagas, that is in extremities, by the Sarpa of any type, Arishta should be applied 4 fingers above the site of Damsha. This may be of some mridu material like ploda, charma, andavalka, that is tree bark, charma, etc. That is restrained by the arishta. The visha does not spread on the body. Moving to the discussion, cloth skin of animals which is soft can be used for tourniquet application. The bandhana should be based on the desha. It should not be too tight or too loose. If the bandhana is tight, it will cause swelling and putrid smell from the site of bite. The bandhana is too loose, then the visha will spread very fast. Tourniquet application restricts the lymphatic flow, not the blood. Once venom enters the body, it reaches the vital parts either through the lymphatic or venous drainage. The hydrostatic pressure in venous capillaries and lymphatic channel is about 20 mm per hg, and larger venous vessel, it is about 100 mm per hg. So the effort can be made to slow down the lymphatic venous drainage. Moving to conclusion, Arishta Bandhana is one of the Chikitsa Upakrama mentioned by all Acharyas. Arishta Bandhana is literally a part of first aid that deployed immediately after snake bite. Acharya Charaka has mentioned after tying Arishta Bandhana, the other measures can be adhered to, like application of Nishpedana, Utkartana, Achushana, etc. And as told earlier, Acharya Sushruta mentioned Venika instead of Arishta. Thank you.
Thank you, Dr. Surabhi. Next, I invite Dr. Shajuddin for the paper presentation on the topic Masurika. Dr. Shajuddin.
Yes, sir.
Okay, doctor. Please share the screen, doctor. Dr. Shajuddin.
Yes.
Dr. Shajuddin, you have any problem with screen sharing, doctor?
Yes.
Don't worry, doctor. I will share for you, doctor.
Okay.
Please start the session, doctor.
Myself. Okay. Good afternoon. Sorry. Good evening. Myself, Dr. Shajuddin. I am going to discuss about the Masurika. Index is introduction, Nidhana, Purarupa, and all. Its definition is like Sarvagatreshu Masura. Here, this is a reference is from Charaka Samhita. Here, Charaka is telling that the pedagas, or there is a formation of a pedagas all over the body, like a masura matra. Masura is like a dhanya, you know. So the in that size, there is a formation of a pedaga everywhere, and he is telling that Pitta Kapha Pradishta. The main cause of this condition is Pitta and Kapha dosha. Coming back to the Nidhana, next slide. Nidhana, so there are so many Nidhanas. This is taken from Madhava Nidhana. He first is telling about the Aharas. Kadu, Amla, Lavana, Shara, Rasa Yukta Aharas, if you are taking. Then Viruddha Aharas, Adyashanas, then Dushta Nishpava and Shagadya. So there we can understood as like old vegetables and cereals, like decay cereals and vegetables. Then Pradushta Pavana Udagehi. That means maybe he's going to he's telling about that if one is exposing in the polluted air or a polluted water, then Krura Grahakshana next is telling about the Sambrabdi. That is because of Graha dosha, and also in the body there is a dosha dushti will be happen. So due to the dosha dushti, there is a rakta dushti also going to happen. So along with doshas, that is vada, pitta or a kapha predominantly, along with the doshas, there is a dushti of rakta also will be there. So according to Arogya Kalpadrumam, there he is telling about that especially pitta dosha, because of dushta pitta or pragupita pitta, there is a dushti of rakta is happening, like that in Arogya Kalpadruma is telling. And here Madhava Nidhana is telling that along with respective of dosha, along with dushta of dosha, the rakta dhatu is also here becoming dushita. And also this is about the Nidhana and Sambrapti. Next slide. About the Purva Rubas, Jwara will be there, Kandu, and Gatra, Banga, Aradi, Brahma, is body pain, and some giddiness will be there, Shota swelling will be there, and Netra Raga, there is a redness in the eye also will be there. Then about types. According to Madhava Nidhana, there are Vadaja, Pittaja, Raktaja, and Kappaja, and Sannipadaja. And but various acharyas, they are different their types. According to Sahasra Yoga, he is telling about 8 types. That is the Tridosh, Vada, Pitta, Kapha, Dundaja, Sannipadaja, Raktaja, and he added a Vishaja. According to various acharyas, there is types are different. In Arogya Kalpadruma also there is different 2 varieties also he mentioned, like Kangu Masuriga and Shudra Masuriga also will be there. And here we can see that in all the types there is a specific properties are there. In Vadaja, there we can see that is the spota or a pedaga will be Shava Aruna Varna, and also it is a Vadaja. So the pedagas are very ruksha, and there will be severe pain will be there. But in case of Pitaja, the spota will be Rakta Varna, and it is a see the P the sometime, and also there will be Daha will be there along with pain. But in Raktaja, similar to Pitta dosha only. And in Kapha, he is telling there that is in about the Pidaga, there is a Shveda Varna, Snigdha, Brisham, Stula Khandu. There is a severe itching will be there along with the pain. There is a pain is very minimal, Mamda Vedana, but there is a severe itching is there. In case of Sannipadaja, it is a Neela Varna Yukta, and that is about the Pidaga. And also in Sannipadaja, there is a severe pain is there, Maharuja is there. And in everywhere we can see all the types we can see that there is a Chirapaga. All the types are Chirapaga, that is very quickly they are separating in nature. And the remaining all the concerned dosha yukta lakshanas also will be there. Next slide. This is the different stages this is the different stages of chicken pox or Masuriga. So there we can see in the first picture is the like a red, and it is a pinkish. And the second picture is a fluid-filled blisters. And third one is it is a crust, and there is a some seed-bedded lesions only will be there. Next is Upadrava. Yes, the Upadrava is there. That is Shota will be there. Swelling in especially in the sandhis, in the joints. If in the joints is affected, in it will be the condition will be going to very severe. So that is especially in the Kurpara Sandhi. Kurpara is elbow joint, Janu Sandhi, Manibandha, and Amsavalaga. That is this all sandhis. If sandhis is affected, then this condition will going to worse. Next slide. Next is Sadhya Sayatva. According to Madhavagara, the Toggada. In Madhavadana, there is he explained about the Adukataja Masurika. That is, the Masurika can be inverts in different dhatu. So based on affecting in different dhatu, it is classified into several types. So in that he is telling that Toggada and Kafaja and Kafa Pittaja are Sugasadhya, and Vadaja and Vada Pittaja and Vada Kafaja are Kashta Sadhya, and Sannipadaja is Asadhya. Then about the treatment, next this is differential diagnosis. In differential diagnosis, that is about regarding the between the Legu Masurika and Masurika. In Masurika, there is a Jwara will be there, and Shirashuladi Lakshanas. As we told earlier, there is a different Lakshanas will be there. This all the Lakshanas in the smallpox or in the Masurika, will be very severe. But in the case of Legu Masurika or in a chicken pox, this all Lakshanas are very minimal. And regarding next is the eruptions, eruptions. This pedagus or eruptions will in the smallpox on the third day of the onset of the disease. It will be erupt, but in the Legu Masurika, the pedagus will erupt only within the 24 hours. And in the smallpox, this eruption will be spread all over the body. There in Legu Masurika, it is not like that. It will be spread gradually only. And in smallpox, these eruptions will be come at first at the vertex, then temple region, then face, and then other parts of the body. But in the case of Legu Masurika, first on the back side of the body, then chest region, then face or limbs. It is about that one. Next is on complete eruption occurs in a smallpox. After eruptions, there is a fever will be there. This fever will be vary. First it will be decreased, then again it will be increased. But in the case of Legu Masurika, there is no change in the fever intensity. Then in Masurika, again, the eruption will be very deeper, and it will be the shape of the eruption will be like a concave in nature. And but in the Legu Masurika, the eruption is like a superficial only. And in smallpox, after curing the condition, it leaves a scar on our body. But in Legu Masurika, there is no scar at all. And in Masurika, all the eruptions will be separate at a time. But in Legu Masurika, there will be not like that. In all the pedagus are separating in a different time. Next slide. Just coming back to the treatment part. In treatment, mainly Charaga, according to Charaga, he is telling Kushtavat Chigalsa, because Charaga is mentioned this in Shota Dhyaya. He is telling that it is like a Kushtavat Chigalsa we have to administer. We can give sometimes Visarpa Chigalsa also based on the Lakshanas. And another, we are focusing on management of fever, and itching will be there sometimes, and also hygiene we have to maintain. In practical application on this disease is like we are using a neem leaf, boiled neem leaf, prakshalana 2 to 3 times per day. And also, if the person can want to bath also after jwara, after jwara moksha, the person can take a bath with a nimbodaka. Then also here, snehana is contraindicated in this condition. If we are applying any thaila, if we know there is itching will be there and all is there. So if we are applying any thaila, this condition will going to worse only. So here after 14 days, we can apply oil. We are using especially the Nalpamara Thailam we can use here. After 14 days, the person can take a bath with again Nimbodaka Kashayam only. Then also in while bath, the person can take instead of a soap, should not use soap. Instead of a soap, he can apply neem leaf and turmeric paste. Have to apply all over the body, and then we can take bath with Nimbodaka Kashayam. Then calamine lotion also very useful here to cure the blisters, and also in he is should not do a sambarka to others. So he is isolated in a separate room. So in that room, fumigation is a very best choice. So we can do fumigation with the gugulu and all. This all are the other treatment modalities. Then especially in Sahasra Yoga also we can see that is explained as so not in Sahasra Yoga, sorry, in Arogya Kalpadrumam. I previously I told about he is mentioned another 2 types, that is Kangu Masuriga and Shudra Masuriga. In Kangu Masuriga is telling in Kangu Masuriga it is Kapha Pradhana Yukta Masuriga. So there he is telling Triphala, Nimbatuk, Padola, Musalli, Parpada. These all drugs we have to make a kashayam. Along with honey, we can administer to the patient. It will cure Kapha Yukta or Kangu Masuriga. Then Shudra Masuriga. Shudra Masuriga is another variety. We can correlate with the Kapha Pitta. It is especially Kapha Pitta Pradhana Masuriga. In that we can, the main symptom of that Masuriga is Jwara and Adhisara will be there. Continuously will be there. So what we can do is...
Hello, Dr. Shajuddin.
Yes.
Doctor, can you speed up your presentation, Doctor?
Okay. I will continue. So next is another yogas are there. So many yogas. This is from Sahasra Yoga, Shundi Baladi, Jivandiadi, Drakshadi, Datri Chandranadi, Gudichiadi, Durilabadi, Nimbadi, Patoladi, Divyamol Kashai. These all are very useful. Then this I take. Thank you.
Thank you, Dr. Shajuddin.
Okay.
Next, I invite Dr. Umesh Arvind for the poster presentation. Hello, Dr. Umesh, are you there?
Yes, sir. Can you share my poster, sir?
Okay, Doctor, 1 second. Hello, Doctor, please, the session, Doctor.
Good evening, everyone. Myself, I am Dr. Umesh Malwar, pursuing my PG in Swasthavatta. I am presenting poster presentation on Panchakoshas. Taittiriya Upanishad has presented this systemically has 5 major sheaths of existence. Anandmay Kosha, Vijnanmay Kosh, Manomay Kosh, Pranmay Kosh, Annamay Kosh. Annamay Kosha is outer covering. So I start with Annamay Kosha. In the tradition of Yoga and Upanishad, the concept of Panchakosha is described in Taittiriya Upanishad. Everything in the universe is sustained by Anna, and everything is dissolved in Anna. This matter-based aspect of physical personality is called Annamaya Kosha. Annamaya Kosha consists of 5 elements. Prithvi, Jala, Agni, Vayu, Akash. Pranmay Kosh. Pranmay Kosh, Pran is the basic fabric of this universe, both inside and outside our body. A uniform, harmonious flow of Pran to each and every cell of the Annamay Kosha keeps them alive and healthy. Manomay Kosh. Mind, which is defined as conglomeration of thoughts respond to the input through sense organ. For example, you see a big red flower. I send the image to the brain and the mind perceives it is a beautiful rose. Within the next fraction of second, your memory deciphers that it is very rare variety of rose, which you wanted to see badly. The thought circulates in mind and chitta, which soon goes on to make you feel, oh, it is so beautiful. I like it, I love it, I want it. This component of the Manomaya Kosha in which this rapid recycling takes place and gather momentum is called emotions. This is characterized by feelings such as likes or dislikes, love or hate. When these emotions become powerful, they start governing our actions against what is right. This going against cosmic law lead to imbalance called Adi or stress. Long-standing Adis get pushed into Pranamaya and Annamaya Kosh, causing Vadis. Vijnanamaya Kosh. Vijnanamaya Kosh is the fourth layer of our existence. The conscience within the continually guides us to do thing or not to do thing is the Vijnanamaya Kosh. It is the component of the mind that has developed in human race greatly that differentially man from the animal. The Vijnanamaya Kosh is discriminatory faculty. Anandmaya Kosh. The knowledge of the final truth is Anand, is the basic step of this universe, from which everything has been created. This is called Anandmaya Kosh. This is also called state of bliss. This is the most subtle aspect of our existence, which is devoid of any form of emotions. A state of total silence, a state of complete harmony and perfect health. Okay, sir. Done.
Thank you, doctor. Next, I invite Dr. Somesh Sandosh for the paper presentation. Hello, Dr. Somesh Sandosh Varade for the paper presentation. Dr. Somesh Sandosh, are you there? Okay, next I invite Dr. Akshay for the paper presentation. Dr. Akshay Trambak Salve for the paper presentation. Dr. Akshay Trambak Salve, are you there? Dr. Akshay, are you there? Okay, next I invite Dr. Pooja Lalu Artwat for the paper presentation.
Yes,
Dr.
sir.
Pooja.
Yes, sir.
Doctor, please share the screen, doctor.
Sir, can you share my paper, sir?
Okay, doctor. One second, Dr. Pooja.
Okay, sir.
Doctor, is this your presentation?
Yes, sir. Sir.
Okay, please start, doctor.
Good evening, all. First of all, myself Pooja Aratwad, second year PG Department of Shalya Tantra, Sri Saptashungi Ayurvedic College, Nashik. Next, sir. And my case paper presentation is Shar Sutra ligation followed by excision treatment for pulmonary sinus. Abstract. Kshar Sutra is an Ayurvedic parasurgical treatment which is used for management of various anorectal diseases like fistula in ano, pulmonary sinus, hemorrhoid, etc. Kshar Sutra ligation followed by excision in a safe time, saving economically affordable treatment for pulmonary sinus. Pulmonary sinus means nest of hairs commonly occurs in air males between the age of 20 to 13 years, and those of who does not sitting job continuously in this study. Patient was suffering from pulmonary sinus midline over the coccyx and treated with Kshar Sutra ligation followed by the excision. In post-operative management, second sitting Kshar Sutra changed at 5th day and third sitting Kshar Sutra changed in 9th day, and then on the 15th day Kshar Sutra removed and excision was done. Keywords: Kshar Sutra, excision, pulmonary sinus, local anesthesia. Introduction. In Ayurveda, Acharya Sushruta describes the 8 types of Nadi Vrana, the shofa of prolonged duration without paka or pakva shofa, ignored by the surgeon, collected good amount of pus, which percolates in the deep muscular planets, which are later on the breast on skin, produce Nadi Vrana. Any kind of micro particles, sukshma shalya in the skin will be quickly produced nadivrana. Pulmonary sinus means nest of hairs and the condition found in the natal left of the orococcyx, also called as a top bottom because it was a very common in the jeep drivers. It is commonly found in the hair males, appears between the age of 20 to 13 years. These are various treatment available for pulmonary sinus such as the excision, Jhadplasty, rhomboid flap, and procedure becomes techniques are with their own limitations in Ayurveda. Acharya Sushruta describe the Kshar Sutra treatment on Nadivrana. Aims: eliminating the diseases with the help of the Kshar Sutra ligation and excision without any complication. Next. Please, next slide, sir. Objective: to study about the Kshar Sutra ligation followed by excision on Nadi Vrana vice versa to pulmonary sinus. Case history: a patient, 26-year-old male patient, came in OPD with complaints of the pain and pus discharge from the midline over the coccyx area since 3 months. He has past history of continuously sitting for more than 10 hours daily for his work. He has no any surgical history or any major illness. During local examination, noticed a pus discharge and external opening of the pulmonary sinus. To know the direction of the tract, probing is done. Routine laboratory investigation for blood, sugar, HIV were done and found within normal limits. The case was planned for Kshar Sutra ligation followed by excision under local anesthesia. Pre-operative. The whole procedure explained the patients and relatives, and written consent was taken from the patient. Preparation for part of done on same day before operation. Injection TT 0.5 ccIM stat was given in prophylactically. Measures for any sensitive test was done with injection xylocaine 2% on the same day of operation. Next slide, please. Operative procedure. Patient was the betadine solution. Drafting was done with sterilized lion sheet. Then local anesthesia given with the help of the 2% xylocaine. Probing of the pulmonary sinus tract and cut taken on another end with the help of plate number 15. Then threading of sinus tract with the help of rope knotting and the thread without tension. Hemostatic saturated packing was done. Patient shifted to the ward with the stable vitals. If it 15 days after patients was laid in left lateral position, pending the areas help the betadine solution. Drafting was done with sterilized line sheet. Then local anesthesia given the help of 2% xylocaine. Incision taken on wound and Kshar Sutra removed simultaneously debris from the cavity. Removed the betadine and H2O2 wash given. Hemostasis achieved, packing and dressing done. Patient shifted to ward. Post-operative, the medication given the patient tablet acetopara 1 BD, tablet Famo 40 mg 1 OD and Sukshma Triphala 1 TDS. On the 5th operative day, second sitting Kshar Sutra changed with length of 2.8 centimeter from the 3 to 3.2 centimeter, and 9th day third sitting per length of Kshar Sutra was 2.4 centimeter. Then the 15th day after excision, tablet isictopara 1 BD and tablet Femo 40 mg 1 OD given to the patient. By the end of the 32 days, then 1 month, post-operative day, all the wounds were observed healed and there was no future of first discharge and external opening. Materials and method. Shar Sutra was prepared as per Acharya Chakradatta by using the Snehik Shira, Apamarga Shara and turmeric powder. Specification of instrument: blade number 15, artery forceps gauze pieces or roller gauze, bitted in H2O2 sterile pad and probe and stitching. Discussions. The Kshar Sutra Samhita describe the condition called as the Shailaja Nadi Vrana, which is similar to the panoral sinus, and advocate the use of the Kshar Sutra. It is management of the applied the Kshar on the thread, acts as the antimicrobial, anti-inflammatory and chemical cauterization, which is promotes the healing process. The pH of Kshar Sutra is alkaline, hence it does not allow the growth of bacteria, and its site of ligation. Turmeric powder minimize reaction, excessive caustics, and help for healing the process. Due to Kshar Sutra ligation, the size of wound minimize, then excision of tract done. So it helps the remove the debris present in cavity. Kshar Sutra ligation followed by excision plays important role for proper healing. Conclusion: Kshar Sutra ligation followed by excision is a safe, advantageous, economical treatment, and binaural sinus under the local anesthesia, and also minimize the size of wound and accelerates the wound healing. Debris is also taken out due to the excision of the tract. Also, this is a OPD treatment method. The patient does not need to the any admit, and also the patient can regularize his work as the patient is less. Pain is less. The have the data only one case, which is the insufficient to. Next slide, please. Next slide, please. Sir, please, next slide. Okay. Draw any conclusion in order. Seen proper outcomes, there is need of further study on large sample of such cases. Reference. Thank you.
Thank you, doctor. And before going to the next presentation, dear participant, the panel strictly reminds the duration. Your maximum time allotted for presentation is 8 minutes. Kindly do follow the time limit.
Okay, doctor. Next, I invite Dr. Sadika Prashant Chavan for the paper presentation. Dr. Sadika. Dr. Sadika Prashant, are you there? Hello, Dr. Sadika Prashant, can you hear me?
Yes, sir. Yes, sir.
Okay, doctor.
Can you
Please
hear
share the
me,
screen,
sir?
doctor. Yes, doctor. Please share the screen,
Okay.
doctor.
Okay. Okay. Good evening, sir.
Share kar.
Share.
Welcome.
Hello, Dr. Sadika. Hello, Dr. Sadika Prashant Chavan. Can you hear me? Sarika, please unmute, doctor. Dr. Sarika, please unmute, doctor. We can't hear your voice, doctor. Please unmute, doctor.
Hello.
Dr. Sarika?
Is it audible, sir?
Yes, doctor. Audible, doctor. Doctor, you have any
Audible.
problem with screen sharing, doctor? You are audible, doctor. Your voice is clear,
Yes.
doctor. You have any
Yes,
problem
I
with
am.
screen sharing, doctor?
Okay, I am sharing the screen now.
Okay.
Is it available, sir?
Yes, doctor.
Hello.
If you have any problem with screen sharing, I will share for you, doctor. You can share
Yeah,
it,
please
doctor.
share. Please share, sir.
Okay, I will share for you, doctor. 1 second.
Okay.
Please start, Dr. Sarika.
Okay. Start.
Hello, good evening, sir.
Shall I start? Teacher.
Good evening, doctor. Please.
Hello.
Good evening, doctor. Please
Shall I
start.
start? Okay.
Please, doctor.
Here I am presenting basics of Snehan, that's Department of Panchakarma. Etymology of Sneha. This word Sneha is derived from root Sneha. It has two meanings. One being Sneha Prithayu, means to render affection, and the other Sneha Snehane, meaning to render lubrication. The term Sneha implies that a substance that brings oiliness or unctuousness. Sneha literally means oiliness, unctuousness, fattiness, greasiness, lubricity, viscidity, affection, love, kindness, and tenderness. Snehana. The entire Shodhan procedure depends upon the proper mobilization of dosha from the Shakha, which is achieved with the help of Snehan and Svedana. Out of these two, the Snehan is major therapy which decides the whole outcome of Shodhan procedure. Definition. Snehanam Sneha Vishyandam Mardam Kledakarakam, described by Charak Sutrasthan 22. The procedure by which Snigdhata, that is oiliness, Vishyandana, liquefaction, Mardavata, softness, and Kledan means moistness is achieved is known as Snehana. Classification of Sneha, that is according to Yoni, Sthavara, that is plant origin, Snehashay, the plant from which Sneha is derived, is called Snehashay. Acharya Charak describes 18 Snehashayas, that is from which we get the Sneha. Tila, Bhallataka, Atasi, Sarshapa, Shigru, Bilva, Priyala, Chitra, Eranda, Karanja, Madhuka, Abhisheka, Bibitaka, Mulaka, Kusumba, and Abhaya. Acharya Shushruta tells Sneha on the basis of action, that is the Virechanartha, Vamanartha, Shirovirechanartha, Dushtavarnartha, Kushtha, Mutrasanga, Ashmari, Prameham, Pitta Sansrushtavat, in Krishnikarnartha, Pandukarnartha, and Dadrukitipa Kushta. It is told by the Acharya Sushruta, which are on the basis of action. Jangam Sneha. Second one is Jangam Sneham. Jangam is the animal source of oils and fats. It is of natural and artificial. Natural is milk, medas, majja, and egg. Artificial is vasa, naonita, dadi, bee wax, or ghee. Fish, avians constitute the sources of animal fats. Dadi, kshira, gruta, amisha, that is meat. Classification of Sneha according to preparation, that is Pak. It is told by Shushrut, Vagbhata and Sharangara. By Shushrut, Mrudu Pak, Madhyam Pak, Khara Pak and Dagda. Vagbhata, Mrudu Chikkana Khara and Sharangara, Mrudu Pak, Madhyam Pak, Khara, Dagda Ama and Mrudu Khara. Based on the route of administration, it is divided into Pana, Basti, Nasya and Bhojan. The retaining types are Shirobasti, Gandusha, Karnapurana, Akshitarpana. Pouring types are Shirodhara, Sneha Parisheka. Applying types are Lepa, Utsadana, Pichu, and massage type is Abhyanga. Classification of Sneha on the basis of dose, that is Matra Bheda. The dosage of Sneha has been described as per the time required for digestion. This is classified as Risva Matra, Madhyam Matra, Uttam Matra. Risva means the dose of Sneha which digests within 6 hours, Madhyam means digest within 12 hours, and Uttam means digest within 24 hours. Acharya Sushruta has further added 2 more categories on the basis of matras, that is the dose of Sneha which digests within 18 hours and the dose of Sneha which digests within 3 hours. Vagbhat has told her Rishiyasi Matra, the quaternary of Sneha which digests within 3 hours. He advised to use this as a trial dose when cost of the subject is unknown. A classification of Sneha on the basis of combination, that is a Samyoga Bheda. Yamak Sneha, Trivrit Sneha and Mahasneha. Yamak means combination of 2 Sneha. Trivrit means combination of 3 Snehas. Mahasneha is the combination of all 4 Snehas termed as Mahasneha. These Sneha combination are used both internally and externally in a Sansarga and Sannipatika condition of doshas. Other classifications are Achha Sneha and Vicharna Sneha. Then further it is divided into Samana Sneha, Brihan Sneha and Shodhana Sneha. Further classification Autarbhaktik Sneha and Avapidak Sneha. It is also classified as Siddha Sneha and Avartita Sneha. Properties of Snehana Dravya and their interpretation. Guru Shita Sara Snigdha Manda Sukshma Dudravama Aushadam Snehanam Prayo Viparitam Virukshanam. Told by Ashtanga Hridaya Sutrasthan 16. The drug having properties like Drava, Sukshma, Sara, Snigdha, Pichila, etc. is called as Snehan drug. Snigdha Guna, which is having Kledan Shakti, is called as Snigdha. Snehakrita, Mardivakrita, Balakrita, and Varnakrita are the properties of Snigdha Guna. Sneha basically is a Vata Shamaka and Kafakara and Vrishya in nature. Next, Guru Guna. The attributes of Guru are Upalepakruta, Sadakruta, Balakruta. These are the Guru substances are Vatahara, Kafakara, Pushtikara, and heavy for digestion. Shita Guna. By virtue of these qualities, Sneha produces the following features, that is Alladanam, Sambana, Murchana, etc. Next, Pichila Guna. Like this, Pichila simply means slimminess. It is having other properties like Jivana, Balya, Guru, Shleshmakara. Next slide, please. Mrudu Guna. This quality attributes softness and looseness of body. Next slide, please. A detailed knowledge of 4 types of main Sneha, that is Gruta, Taila, Vasa and Majja. Gruta is considered as superior Sneha Dravya because of its following characters, given by the Ashtanga Hridaya Sutrasthana. Then next slide, please. Grita. It is the best among all the Jangama Sneha because it has having special properties. Classification of Gruta is given by the Acharyas, Nava, Purana, Purana, Prapurana, like this, etc. Grutam Pitta Anilam Haram, Rasa Shukroja Sahitam, Nirvapanam Mrudukaram, Swaravarna Prasadanam are the properties of Gruta. Then next slide, please. Doshagnata, Vata Pitta Shamakam, Seasonal indication in Sharad Rutu, suitable condition for use of Grita. Vata Pitta Prakriti, Vata Pitta Rogi, those desires of longevity, Balavarna and Swara, Pushti Smriti Medha, Vriddha Balam, Daha Pidita, and Visha Pidita. Physical properties as given in the next slide. That is the action of ghee. Short chain fatty acids easily metabolized and release the energy. Then monosaturated fat considered to be very healthy and resistant to oxidation. Likewise, lauric acid is present, mystric acid, palmolic acid, and stearic acid and oleic acid. All these acids are present in the Grita, Taila, Marutagnam cham, Shleshmavardanam, Balavardhanam, Twacham, Ushram, Sthirakaram, Tailam, Yoni Vishodhanam, Charak Sutra by. It is told by Charak Sutra. The properties of Taila are given in the Charak, that is Rasa, Guna, Virya, etc. Action on Dhatu of Taila, that is, it is good for Rasa, Shukra, and Oja, that is, it is Rasayana. Karma, migrates Vata and Kapha, increases Pitta, Bala, Varna, Mardavata. Likewise, seasonal indication is Pravrit and Sita Kala, suitable condition for use of Taila, Vata Prakriti, Shleshma Vruddhi, Medha Vruddhi, Taila Satma, etc. Next slide, please. Sesame oil. It is a power antioxidant, high source of vitamin E, phytoestrogen, and low in saturated fat, having property of anti-cholesterol agent. Next slide, please. The constituents are given in this slide. Next slide, please. Vasa. The Vasa, it is the fourth Sneham. Vidyabhagnahat Brashtayonikana Shirorujaham, Paurushopachoy Snehe Vyayame Ishyate Vasa. It is told by Charak Sutra. These properties are similar with the mounts of animal of which they are obtained. That's why given in here. Suitable conditions for Vasa, that is best Agnibalam, able to tolerate wind and sunlight, Ruksha, emaciated from weight lifting, etc. Next slide, please. Majja. बलशुक्र रसश्लेष्म मेदो मज्जा विवर्धनः मज्जा विशेषतो अस्नां च बलकृत स्नेहने हितम्. It is told by Charaka Sutrasthan 13. Properties of Majja are given, that is Diptagni, Klesha Saha, Krura Koshta, Sneha Satmya, those who desire of Bala, Shukra Majja and Astivardhana and Snehana. Next slide, please. Mahasneha. The use of all four snehas, that is Gruta Taila Vasamajja, its combination is called as Mahasneham. Charaka has described the properties of Mahasneham for Snehanas Jivanya, Varnya, Balya Upachaya, and Vata Pitta Kapanashak. Next slide. Properties. Next slide. Next slide, please, sir. Overall action of four sneha on dosha. Here is given Pittagnaste Yatha Purvam Ittaragnaha Yatottaram Grudatailam Guru Vasaha Tailam Majja Tatoapicha. That is on Pitta dosha Vata Vasa Pittagnata, Majja Pittagnatara, and Grata Pittagnatama. The properties are given here. Summary. Understanding basics of Snehan is very important in overall management of patient by Shamana and Shodhan Chikitsa. Thank you.
Thank you, Dr. Sadika. Next, I invite Dr. Smita Pradeep for the paper presentation. Dr. Smita.
Good evening, sir. Can you share my PPT, sir?
1 second, doctor.
पहिलं presentation असंच व्हायचं.
One second, Dr. Smita.
Yes, sir.
Dr. Smita, please start the session, doctor.
Yes, sir. Good evening all. Myself, Dr. Smita Makasari, PG Scholar Swastarutta from PDS College of Ayurveda Research Center, Nigdi, Pune. Topic of my paper presentation is Role of Swastarutta in Sports Medicine. Next. Introduction. Sports medicine is a separate medical specialty in the medical field. Swastarutta act as a preventive, so it is the best medicine and plays a major role in sports medicine. Dinacharya, Rutucharya, Rasayana, Chikitsa, Yoga, Vyama, Dhyana, and so on all play important role. Material and methods, data collected from various classic texts of Ayurveda and Yoga. Charak Sahita, Ashtang Hruday, Bhav Prakash, Sushrut Sahita. Research articles are also looked up on websites. Next, sir. Purpose of the study is to review the preventive role of Swastarutta in sports medicine. To study Ayurveda principles like Rasayana, Dinacharya, Rutucharya, Vyama, Yoga, Dhyana in sports medicine. Next. Rasayan therapy. Sports person require physical and mental stamina for perfect health. Rasayana therapy helps for perfect health by balancing Tridosha and Saptadhatu. Rasayana helps to increase Bala Ruddhi, that is strength. Rasayana drug improve Dhatu and Snayu. Depending on the needs and individual condition of the sports person, such as for anti-stress effect, Ashwagandha, and for adaptogenic effects, Shilajatu is used. Dinacharya and Rutucharya, daily regime and seasonal routine for preventing diseases and promoting the individual's health. It is essential for the sports person to follow the concept of Dinacharya and Rutucharya to maintain the hygiene of the body, to prevent disease in the long run, to upgrade the health and proper functioning of the sense organ, to improve and maintain physical strength, to keep the mind in peace. Next. Vyama, that is exercise. Training in sports is of prime importance for fitness and involves physical exercise, which improves muscle tonicity and strength are increased, as are cardiac and respiratory functions. It is also useful for lightness of the body, brings stability, improve the digestive capacity, capacity to withstand pain, discomfort, capacity to work. It increases the carbohydrate metabolism. It takes out the accumulated toxins from the body. It increases oxygen supply to remote tissue and increase base metabolic rate. Next. Abhanga, that is massage. Anointing all parts of the body with followed by massage is considered as Abhanga. Vata dosha is dominated in sports person. So, Tailam considered as best for massage. Manipulation of body parts by massage enhances the overall blood circulation and nourishes the body part. It helps for proper functioning nerve. It enhances the release of endorphins and enkephalins, which have analgesic effect. Next. Yoga. Asana, pranayama, Surya Namaskar, Trataka, Kapalbhati, Mudra, etc. are useful for sports person for various purposes. Yoga improves their concentration. It helps in developing physical fitness and it is also good for relaxation, good for rehabilitation after injury. It helps to maintain fitness and agility. It also helps to reduce stress and anxiety, cultivate self-confidence and self-belief. Next. Dhyana. Dhyana, meditation. Meditation is the practice of concentrated focus upon a sound, visualization, object, the breath, movement, or attention itself in order to enhance awareness of the present moment, reduce stress, induce relaxation, improve personal and spiritual growth. Next. Result: to prevent injury of sports person, Swastarutta play important role. Vat dosha, which is prime and most common cause of sports related disorder. Vat dosha is maintained by following the Dinacharya and Rutucharya regime. A person will get health, longevity, intelligence, memory, power, youth, luster, and complexion, good voice, and stronger sensory and motor organ by using Rasayan therapy. Yoga also helps to reduce stress and anxiety, cultivate self-confidence and self-belief. Meditation is to calm the body, mind complex, reduce stress, and achieve normal homeostasis. Next. Conclusion: Swastarutta regime balance the three dosha. Swastarutta should be given attention in the field of sports medicine for prevention. Its scope in sports medicine for the betterment of sports person. Swastarutta can act as preventive and curative lifestyle in sports person. Thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Bhanu Mahajan.
Hello.
Hello, doctor.
Ma'am, can you share my screen?
1 second,
Please
doctor. I will
go
share for you. Hello, Dr. Bhanu.
Yes.
Please start the session, doctor.
Okay. Good evening, everyone. My name is Dr. Bhanu Mahajan, PG scholar, GSC Osmanabad. So my today's topic a review of Dhatu Poshan Nyay. Next slide, please. Introduction. Ayurveda is an ancient system of medicine based on experience of many acharyas for centuries. Ayurveda always focus on the state of equilibrium of dosh, dhatu, and mala of the body. These three are the biological and functional unit of the body. In Ayurveda, three upastambhas are mentioned, that is ahar, nidra, and brahmacharya. The type of ahar we eat shows its effect on our physical as well as mental health. First of all, the ahar gets converted into aharas with the action of Jatragni. After the formation of aharas, it gets converted into seven dhatus by the action of their respective seven dhatuvagnis. This process of dhatu formation continues from birth till the death. Almost in every Samhita, the concept of dhatu poshan is given. Dhatus get their nutrition in a progressive manner, beginning with the ras dhatu and ending with the shukra dhatu. In Ayurveda, different theories are given by different acharyas about the process of nourishment of different dhatus, and these theories are also known as Dhatu Poshan Nyay. Aims and objectives. To study the concept of Dhatu Poshan Nyay, material and methods. A review of literature, it will be taken from ancient era till date, Ayurvedic classical literatures, Charak Samhita, Sushruta Samhita, and Ashtanga Hridayam, and various modern textbooks and journals has been taken for this study. Next slide. Concept of Dhatu Poshan in Ayurveda. According to Ayurveda, food is the main pillar of healthy life. Hence, we can get many useful references in compendia regarding the food and nutrition. As already discussed before, all the dhatus are formed in the garb, and these dhatus receive nutrition from birth till after the birth. According to Chakrapani, after birth, dhatus are only nourished and repaired by aharas because they are already formed in the garb. According to Chakrapani, as far as the growth and development of the dhatu after birth is concerned, instead of dhatu formation, dhatu poshan, where nutrition of dhatu is correct term. Next slide. Metabolism of dhatu. Synthesis of new dhatu from aharas and breaking down of the old dhatu is a cyclic process, as given the reference in Charak Chikitsa 15th chapter 21 verse. Cyclic process. Sequence of dhatu portion. According to Charak and Shushru, the sequence of dhatu portion is given in the various shlokas as Shushru Sutra 14 and Charak Chikitsa 15. Now the theories of dhatu portion. Charak and Shushru have explained only the sequence of dhatu portion, but the commentators of Charak and Shushru have elaborated the process of synthesis of dhatu from aharas on the basis of theories of dhatu portion. And these theories are Shirdadi Nyay, Kedari Kulya Nyay, Khale Kapot Nyay, and Ekal Dhatu portion Nyay. Next slide. Definition of dhatu portion Nyay. Nyay, which explains the process of synthesis of dhatu from aharas, are called as dhatu portion Nyayas or theories of dhatu portion. Shirdadi Nyay or theory of total transformation. Acharya Dalhan introduced this Nyay, also known as Karam Parinam Paksh or Sarvatam Parinam Paksh. This beliefs hold that the Purva Dhatu is entirely transformed into Uttara Dhatu, just as milk is entirely converted or transformed into curd, and curd is again transformed into butter or butter into ghee. Qualities of milk and curd are different. Milk is liquid, cold, and sweet, while curd is heavy, hot, and sour. In the same manner, dhatus are different from aharas. Sequence of dhatu portion is easily understood on the basis of Shirdadi Nyay. Aharas is transformed into 7 tissues, just as milk is transformed into curd. If seen from the point of modern physiology, Shirdadi Nyay justifies the transformation of complex food into simple compounds, and the end product of digestion include glucose, amino acids, fatty acid, and glycerol. Next slide. Now, there are reasons for rejection of Shirdadi Nyay. According to Shivdas Sen, if a person remains on a fast for 3 or 4 days, the cycle of formation of aharas from food will break, and there will be difficulty in the formation of dhatus. And due to interruption of in the cycle of formation of aharas, the body will not get aharas for nutrition of dhatus, which can lead to total depletion of ras and ras, etc., which will result in death. Person who remains on fasting for 1 month will have only Shukra Dhatu and will not be able to survive in such case. Payas means milk. Milk immediately nourishes Shukra Dhatu, but Shirdadi Nyay fails to explain immediate nourishment of Shukra Dhatu from milk, because according to Shirdadi Nyay, nutrients formed from milk has to undergo for transformation serially from ras, rakta, mas, etc., and finally into Shukra Dhatu. This will take at least 30 days from Shukra to form. Kedari Kulya Nyay, or the transportation process theory. Bhav Mishra provided this Nyay. Kedari means farm and Kulya means the water canals. For the cultivation of grains, farm is divided into small pieces and water is applied to these small parts and canals. Water canals in the farm are connected to water source such as well or water pump. Portion of farm near to water source gets water earlier than the portion that is away from the water source. According to Kedari Kulya Nyay, farm, water canals, and well are the symbol of human body, blood vessels, and heart respectively. From heart, the rasa is pumped out and circulated in the blood vessels, and blood vessels circulate the aharas to every dhatu, and dhatu takes up its nutrition from there. Dhatus are formed serially from aharas, hence Kedari Kulya Nyay is also known as Kram Parinampaks, and specific part of aharas nourishes specific dhatu, so known as Anshansh Parinampaks. According to physiology, the diffusion of fluid across cell membrane pressure gradient is required, and this pressure gradient can be explained on the basis of transportation process, which can be best explained by Kedari Kulya Nyay. Next slide. Reasons for acceptance of Kedari Kulya Nyay. Kedari Kulya Nyay explains the sequence of dhatu portion. Kedari Kulya Nyay described Ayurvedic concept of circulation of nutrients in the body, immediate nourishments from Shukra Dhatu formed from milk. When all the dhatus are in the state of equilibrium, all dhatus are formed according to Kedari Kulya Nyay. Next. Khale Kapot Nyay, or the theory of selective absorption. Khale refers to the field where the grains falls after the crop is cut, and Kapot refers to the birds. Birds gather around the field of the grains to pick up their food and fly off the respective nest. Birds whose nests are near to the field will reach their nest earlier, and those who live far away which will reach late. Birds are the symbol of dhatu, while nutrients of dhatu are compared with the food of each bird, and status of dhatu is compared with the bird nest. Just as each bird requires different food, in the same way each dhatu needs different type of nutrition. For example, dhatu needs iron, while med dhatu needs fatty food for nutrition. Next slide. Mm. Reasons for acceptance of Khale Kapot Nyay. It describes independent nourishment of dhatu, just as receptors on the cell surface binds with a particular substance. For example, receptors of glucose of cellular surface binds only with the glucose, not with any other substance. In the same way, dhatu have capacity to identify their nutrition. Autoregulation mechanism is explained with the help of Khale Kapot Nyay. According to Khale Kapot Nyay, every dhatu receives separate nutrients. Hence, diseased state of one dhatu every time doesn't necessarily affect the remaining dhatus. Immediately, nourishment of Shukra dhatu from milk is justified because nutrients of Shukra derived from digested milk are rapidly carried to the channels of Shukra independently. Now, Ekkal dhatu poshan Nyay. Arun Dutt gives this the Nyay in the Vagbhat Sahita. According to this Nyay, Ahara simultaneously nourishes all dhatus through their dhatu strotas. According to this law, if Agni is strong, dhatu portion will be quick, but if it is weak, dhatu portion will be slow. Next slide. Importance and application of theories of dhatu portion Nyay. Shirdadi Nyay explains genesis and differentiation of 7 dhatus from each other, just like milk, curd, butter, ghee are different from each other. Concept of nutrition of aharas and its circulation is well explained by Ketarikul Nyay. And Khale Kapot Nyay required to understand concept of selection of own nutrients, just as concept of cellular receptor bindings. Human body has tendency to maintain normal volume of every dhatu, which can be called as auto-regulation mechanism. Khale Kapot Nyay explains auto-regulation mechanism because according to this theory, at resting position, requirement of nutrients is less, so dhatu will not allow to enter more nutrients inside. Just as bird will not pick up grain when they are not hungry. Craving for sour food and the deficiency of Rakta Dhatu is well understood by Khale Kapot Nyay. According to Khale Kapot Nyay, nutrients of Rakta Dhatu formed from digested sour food especially increases Rakta Dhatu. Volume of Ras Dhatu immediately increases after drinking water. Water immediately replenishes Ras Dhatu, which is understood on the basis of Khale Kapot Nyay. Next slide. Thank you so much.
Thank you, doctor.
So next I invite Dr. Nikita Sharat Rao Mahajan.
Yes, ma'am.
I invite Dr. Nikita.
Yes, ma'am. Just a minute. I'll share my PPT.
Okay, doctor.
Yes. Is it visible?
Yes, doctor, it's visible.
Hello, everyone. Myself, Nikita Mahajan, PG Scholar, Sri Rog and Prasuti Tantra Department from College of Ayurveda and Research Center, Nigdi, Pune. So today's my topic is case report of Andhyatva with special reference to infertility related to unovulation. So today, infertility is the leading problem in today's era. And due to changing lifestyle and stress, increasing stress, unovulation is the main cause of female infertility. As per Maharshi Kashyap, Nasya has role on especially on Pranavata and Udanavata. So to treat imbalanced HPO axis, the nearest route is the Shira, that is through Nasa Marga. So the easily available Shatapushpa Tail Nasya as a Shodhan Nasya is selected. We conducted a study on 30 patients from our OPD and IPD section. We give them Shatapushpa Thailand as 8 drops in each nostril from 5th day of menses to the next 7 days, continuously in 3 consecutive cycles in PCOD. Previously, there are many works done on the anovulation or female infertility as per our Ayurveda. So our objective is to study the efficacy of Shatapushpa Telnasya on ovulation in polycystic ovarian diseases. We conduct a simple open clinical study. 30 patients from OPD and IPD. Duration of study is 1 year and duration of treatment is 3 months. Study design, clinical study is screening the subject from inclusion criteria. Initial assessment and enrollment was done in administration of the drug by nasal route. Follow up with assessment of patients, monitoring of follicle by USG, 3 consecutive cycles, and data collection and systemization done, and inferences and conclusion will be drawn on statistical analysis. Inclusive criteria, patient fulfilling the PCO criteria, married woman, age group between 20 to 35 years. Plan of research is drug and disease review, collection of drug authentication and standardization, preparation of drug, clinical trial and statistical analysis. And we collected the drug Shatapushpa, Latin name Anethum sova, and we made the Shatapushpa tel as per the Samhita Madhyam Khanda Adhyay 9, and drug we formulated the drug and authenticated it, and then we carried the trial on the patients. Duration is 5th day of menses, from 5th day of menses to next 7 days for consecutive 3 cycles. Purvakarma Sthanik Snehan with Tilatel and Sthanik Svedan Bashpasved for 5 to 10 minutes. Pradhan Karma is Nasya Karma, Shatapushpa Taila Nasya, Madhyamatra, that is 8 drops in each nostril, and Paschat Karma is Koshna Jalagandush. Objective criteria is USG, that is ovulation study, and subjective criteria is polycystic ovaries, irregular menses, and the symptoms which are the criteria for PCOD. Here is one case, known case of PCOS. Patient is come for the secondary infertility. Prior investigations are normal, but anovulatory cycles are noted. So before treatment, anovulation plus PCOS. After treatment, the ovulation is done and follicles are ruptured properly. Here's the same primary infertility case with the PCOS, and same results are noted. Patient was advised for IVF. Result and discussion. Total 30 patients were having anovulatory cycle, in which 28 patients were ovulated and 9 patients conceived after 3 consecutive cycles of Shatapushpa Nasya Karma. So we concluded that Shatapushpa Taila Nasya is more beneficial in anovulatory infertile patients. Here are some references and bibliography. Thank you so much, Doctor.
Thank you, Doctor. Next, I invite Dr. Rohini Vijay Rao for the paper presentation. Dr. Rohini, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes.
Your screen is visible,
visible?
Doctor. Visible, Doctor. Please
Okay,
start, Doctor.
Good evening, everyone. Myself, Dr. Rohini Mate, PG scholar, Srirog Prasuti Tantra Department from College of Ayurveda and Research Center, Nigdi, Pune. My today's presentation topic is effect of Apamarga Kshara Taila Uttarabasti and Palagrita in bilateral tubal blockage. Abstract. The present case study was carried out to evaluate the role of Uttarabasti with Kshara Taila in tubal blockage in order to establish it as a safer and cost-effective Ayurvedic treatment modality. The criteria for selection of tubal blockage diagnosis is hysterosalpingography (HSG). The Uttarabasti was administered after session of menstruation. After session of the menstruation to the screen patient through hematological, urinary, and serological investigations. The results suggested that Uttarabasti is highly significant treatment for tubal blockage. Uttarabasti is the ideal local therapy is to be adopted in tubal block.
The Kshara Taila is very good Vata, Kapha, Shama, Guna and Lekhan properties. Taila is having the property to reach minute channels in body. The Falagrita is the best for all yoni rogas, also to reduce daha, which is due to Kshara Taila. Introduction. Infertility is a condition of abnormality of the male and female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of irregular unprotected sexual intercourse. Infertility affects millions of people of reproductive age worldwide and has an impact on their families and communities. Estimates suggested that between 48 million couples and 186 million individuals live with infertility globally. Type of study: observational single case design without control group. Material and method: literally study references collected from Ayurveda, that is classics, commentaries, modern literatures, research journals available in institute library, online portal like PubMed Central, Ayush Research Portal, Google Scholar, and analyzed to frame conceptual work. The case study: patient was selected from OPD of ARSHM Nigri Pune, who was ready to give a written voluntary informed consent before starting the treatment. Inclusion criteria: age between 25 to 40 years, bilateral tubal block, husband with normal seminogram. Exclusion criteria: the genital tuberculosis, pelvic inflammatory diseases, endometriosis, hydrosalpinx, suffering with any severe systemic illness, adenomyosis, uterine fibroids, congenital malformations, uterine prolapse, and uterine hyperplasia. Study details: a 28 years female patient came to the ARSHM OPD with the chip complaints, unable to conceive since 1 year. History of present illness: according to patient, she was asymptomatic before 1 year. Then she developed the complaint of unable to conceive. She had a reinvestigation hysterosalpingography on 20 September 2021 revealed that both fallopian tubes having bilateral terminal tubal block. Past medical history: taking allopathic medicine for 3 months for same problem. The menstrual and marital history: menarche at the age of 13 years. The past menstrual history: 4 to 5 days bleeding, 16 to 90 days irregular moderate flow and painless. Took tablet letrozole TDS for it 4 to 5 days, in between 20 to 30 days regular moderate flow without pain. The LMP 27 February 2022. Married life 3 years and active married life is 1 year. Investigation done. HSG 20 September 2021 HSG suggested bilateral terminal tubal block. Husband semen analysis is normal. The treatment schedule: Abhyanga. The Sarvanga Abhyanga was performed with an Narayan Tela. Svedana, Sarvanga Svedana, Bashpa Sveda performed with a Dashamula Kvata. Pradhana Karma, Uttar Basti. Period from 6th and 7th day of the menstrual cycle. Drug used for Uttar Basti, Kshara Tela, quantity 5 ml. On 8th day of menstrual cycle, drug used for Uttar Basti is Falagrita, quantity is 5 ml. Procedure: first, patient was asked to empty the bladder. Then patient placed in lithotomy position. Cleaning was done by the normal saline. Cusco speculum was introduced. Cervix visualized properly. On 6th and 7th day of menstrual cycle, lukewarm apamarga shara tela, and on 8th day menstrual cycle, lukewarm falagrita were instillated in the uterine cavity with IUI cannula attached to 5 cc syringe. Yoni pichu in falagrita applied in vaginal canal. Pashyata karma: patient was kept in head low position for at least 2 hours for better absorption of drug. Vital data of the patient was noted. Patient is kept under the observation for any complication. Complications: severe abdominal pain, bleeding per vagina, oil embolism, etc. Advice: to avoid intercourse during 3 days period of Uttar Basti treatment. To avoid the spice, overeating, fried food, and overnight food. to avoid the day sleep and the night vacation. Shamana Chikitsa Phalagrita, 5 gram empty stomach with hot milk twice a day. Shatavari 10 gram BD with milk before food. Result, hysterosalpingography done on 6 April 2022 shows normal HSG, no feeling defect is seen in uterus, no space occupying lesion is seen. Both fallopian tubes are well defined. There is no abnormal dilatation of tubes and are normal with spillover of contrast on both sides confirming patency. After 2 months in June 2022, patient is conceived. USG done on 20 September 2022. The single lie intrauterine pregnancy of 12 weeks 2 days Liker amni is adequate. Cardiac activity was 170 bpm. Fetal movement are satisfactory. These are the reports. Before Uttar Basti, after Uttar Basti and pregnancy report. Discussion. The female infertility is a yonigat vikara and pacification of phytated vata is the best cure for yonigat vikaras. In Ayurveda, Sneha and Basti said to be best treatment for vata. In the Constate of Uttar Basti, Acharya Charaka has mentioned that once the vata is controlled by Uttar Basti, female achieve conception quickly. It is procedure where the drug are administered directly into the garbhashaya. Therefore, Uttar Basti with Sneha will definitely act on yonigat vikara and hence on female infertility. One of them is a Phalagrita, describing Sharangdara Sanhita Madhyam Khanda. It has been indicated as a useful medicine for Vandatva. Taking references from there, the Grit has been selected for orally. Phalaghritam is used and the properties of the drugs used are Shodhakara, Shukrala, Vrishya, Prajastapana, Rakta Doshhara, Deepana, Grahi, Vishahara, etc. The combined effect is useful for the management of Trivandatva. Conclusion. In the tubal blockage, medicine should be instilled in the uterine cavity, but nearer to the fundus and the uterine cornea. Thus, it is easy to reach up to the fallopian tube. It is more essential to pass the internal os when we are treating cervical and ovarian factor, but it is more beneficial or mandatory when we are treating uterine and the tubal factor. Apart from this, Uttar Basti may stimulate certain endometrial receptors and correct the physiological process of reproductive system. It may also help to endometrial rejuvenation process. A high intrauterine Uttar Basti with Lekhana Dravyas is given in tubal factor and act in two ways. It directly may remove the obstruction of tube. It also normalizes the tubal function by scrapping and regeneration tubal cilia of fallopian tubes. Uttar Basti is an ancient Ayurvedic procedure which is beneficial in gynecological disorders. In present era, only Anuvasana, oil-based type of Uttar Basti is in practice to treat Vandatva, but it can be great opportunity to evaluate its efficacy in several other gynecological disorders by some experimental and clinical researches and through our ancient procedures. Some references.
Thank you, Dr. Rohini.
Thank you.
Next, I would like to invite Dr. Umesh Kamalakar. I invite Dr. Umesh.
Dr. Umesh, are you there?
Dr. Umesh, please unmute.
Hello.
Hello. Dr. Umesh, can you hear me?
Sir, I'm here.
Okay, doctor, please share the screen, doctor.
Sir, can you share? Please share.
Okay, doctor. 1 second, I will share for you, doctor.
Please share my screen, sir.
Okay, 1 second, doctor. I will share for you. 1 second, doctor.
Okay, sir. Thank you.
Dr. Umesh, Please start, doctor. Please start the session.
Yes, sir. Yes, sir.
Please start, doctor. Please start the session. Is the screen is visible, doctor? Hello, Dr. Umesh. Please start, doctor. Hello, Dr. Umesh.
Yes, sir.
Please start, doctor. Screen is visible. Please start, doctor.
Okay, sir. 1 minute. Yes, okay, sir. Can you hear me?
Yes, doctor. Please start.
Okay, sir. Myself, Dr. Umesh Kamlakar More. I am PG student from Shalajinta Department, Government Ayurveda College in Nanded. My topic is role of Kulatta Sendo Sherpunga Kath in the management of Mutraspari with special reference to urolithiasis. Next, nowadays, many incidents of urinary calculus are seen. According to Indian Journal of Urology, prevalence of urolithiasis is male 10.6%, female 7.1%, and both sexes are 8.85%. Is next. The outline of the presentation, introduction, aim, and objectives, review of literature, discussion and result. In conclusion. Next slide. In introduction, Ayurveda, the ancient science of life, is one of the part of India. Ayurveda is dealt with many dreaded diseases under the heading of Mutrakurcha, Mutragat, Mutrashmari. Acharya Sri, the pioneer art in the science of surgery, has described widely comprehensive about Mutrashmari, its classification, symptomatology, etiology, pathology, complication, and management. Next slide. Ashmari Kapapratan Tridoshi Vyadhi. Ashmari Ashtomagat is one of the 8 troublesome diseases. In modern science, the disease can be correlated with urolithiasis. Acharya Sushru says before going for the surgical procedures, one should try to manage with oral medications like Grita Telak, Sharak, etc. Next slide. Aim and objectives. Aim is to study effect of Kulatta Sendau Sherpunkapat in the management of Mutrashmari. Objectives to study Mutrashmari and its management, to study Mutrashmari and correlate with renal calculus. Next slide. A review of literature, drug review, disease review. Ashmari means formation of asthma-like substance within urinary system called Ashmari. Anatomy of Mutravas Rotas given in the ancient classes are Rukka, Gavini, Bastian, Mutraprasik. Physiology related to Ashmari is described as Sar and Kit are the two end products of digestive food. Sar nourishes Rasadi Dhatus, Swed, Mutra, Purisha are the three main malas which executed from body. Next slide. Kita serve this malas Mutra nadis constantly carry into urine into Basti and keep it moist in the same manner as the river carry their water into ocean. These nadis originate from Pakwashai in the form of very minute opening. Ashmari Tridoshani Vyadhi, Pradhanin Kapadosh. Next slide. Types. According to Sushrut, there are 4 types of Ashmari: Vatas, Pittas, Kaphaj, and Shukraj, and give their appearance. Kaphaj dosh, Ukutanda Pratikasha, Madhuka Pushpavarana, Pittas dosh, Balataka Asti Pratimam, Madhu Varna, Vatas dosh, Kadamba Pushpa, Toka Kantaka Chitta, Shukraj, पीडित मात्रेच तस्मिन्नेव प्रदेशी प्रविलयम् आपाद्यते. Next slide. According to modern urolithiasis, the formation or presence of stone or calculus in urinary system is one of the most common disease of urinary tract, causes infections, like a recurrent infection of urinary tract, hot climate due to excessive water loss and in the lower intake of water, dietary factors, excessive ingestion of excessive products of calcium oxalate, metabolic changes, hyper excretion of insoluble urinary constituents like oxalate, calcium, potassium, and xanthine. Next slide. Next slide, sir. Types of calculus: primary calcium oxalate, uric acid, phosphate, synthine, and xanthine. Secondary are triple phosphates. Clinical features: flank region pain, hematuria, guarding rigidity, burning micturition, nausea, and vomiting. Next slide, sir. There are a type of kidney stone, calcium stone, uric acid stone, cystine stone in their appearance. Next slide, sir. Mechanism of stone formation. Stone formation is a complex process involving crystal nucleation aggregation and fixation within the kidney and more aggregation and secondary nucleation. These steps are heavily moderated by the balance of amount of stone constituent appearing in the tubular fluid. Their concentration are affected by water restriction, the pH of tubular fluid, and urine. And the balance of promoters and inhibitors are not major components themselves of the clinical stones. Next slide. Dravya review. In Kulatha cause, Kulatha Sharpunka and Sindhavati drugs, Kulatha, Latin name Dolichos biflorus, Kashairas Ushna Virya Amla Vipat, Laguruksha Tikshna Guna, and Kafavata Shamak, Sharapunka, Tikta Kashairas Ushna Virya, Katu Vipat, Laguruksha Tikshna Guna, and Kafavata Shamak. Sendav Lavan, Lavan Madhura Rasa, Shita Virya, Lagus Nigida Guna, and Tridosha Shamaka. Next slide. According to Bread Negato Ratnakar Khandapayo Ashmari Rogade, it contains Kulatha Sharpunka Sendav. Those oral administration of Kulatha Sendav Sharpunka caught 40 ml plus per day. Type of mutrasonic symptoms and can be correlated to type of renal calculus and their appearance. After we going to literature of Mutrashamari, we found that Kulatha causes must be significantly treated in renal calculus. The Kulatha caught the conclusion. It is concluded that Kulatha caught is very helpful in the treatment of renal calculus. Thank you, sir.
Thank you, Dr. Umesh.
Thank you,
Next, I
doctor.
invite.
Thank you so much.
So next I invite Dr. Bhagyashree. I invite Dr. Bhagyashree. So now I invite Dr. Sushmita Bhatt.
Hello, Dr. Sushmita, are you there? Next, I invite Dr. Sonali Ramesh Sende for the paper presentation. Dr. Sonali Ramesh, are you there? Hello, Dr. Sonali Ramesh, are you there?
Hello.
Hello, doctor.
Hello.
You are audible, doctor. You are audible.
Am I
Doctor, please share the screen, doctor.
Thank you. Give me a moment.
Your screen is visible, doctor. Please start the session.
Yes. Yes. Hello, good evening everyone. Myself Dr. Sonali Jain, TV scholar Chala Keranti, Yola KMC Islampur Sangeet. Today's topic for my presentation is Darunaka and its Ayurvedic management. Contents of my presentation is introduction, objective, result and discussion, and conclusion. Here goes the intro. Featured with extreme dryness and spreading of the skin over the scalp region. Ayurveda explains dandruff by the name Darunaka, included under Sidra Roga by Acharya Sushruta and Kapalagata Roga by Vajrata. Dandruff is an irritative disease of scalp in which shedding of dead tissue from the scalp with itching sensation is the main feature. It is the most common cause for the hair loss. It is more of a social problem as a person with Darunaka is quite likely to feel down on a social room. Although it is harmless, it can be embarrassing for those who have it. The objective of my study is to study Darunaka and its management. Results and description says that Darunaka is a common chronic scalp disorder in which flaking of the skin of the scalp. As skin cells die, they fade from the scalp surface. In Sushruta Nidhansthana, chapter 13, he explains Daruna Kandura Rukta, Keshavuni Prapachate, Tapavata Prapopena, Vidya Darunakam Sutat. Main causes of Darunaka include improper cleaning of scalp, non-application of facial oil, sleeping during daytime, Vejavadharana, exposure to dust, and hot weather. Darunaka Samprapti goes like Samprapti Karak of Darunaka, Aruvati Dosha, Kapha Dosha, Rasa Dhatu, Rakta Dhatu, and Swaka, which is the Upadhatu of master. Due to Vata Kapha Prakopa Kahara Vihar, Rasa and Rakta Dhatu Dispito Moskrota which leads to the Darunaka at the Swaka Adhisthana. Symptoms of Darunaka include cecity, that is falling of the hair, Kandu, itching on the scalp, Swakasputan, cracking of the scalp, and Rukshita, dry scalp. Management. According to Acharya Sushruta, he includes Shiraveda, Shirovasti, and Shirachalana with Kodrava, Truna, Charitoya, Avapidanasya, Nehana Svedana of Murta, that is head. Formulation includes the first formulation, Nilavrungadi Taila. It is explained in Taila Yoga Pratana 28. It contains Swarasa, Shira, and Kalka. In Swarasa, it includes Nili Swarasa, Sundaraj Swarasa, Dhaत्री Swarasa. Shiras includes Ajat Shira, Narikela Shira, Mahish Shira, Godika. Kalka includes Yashti Kalka, Kunja Kalka, Anjani Kalka. Mode of applications are Shirabhanga and Nasya. Properties of this taila is Sita Gunatma and Chitrashana. Next, Amalya Dilepa, Amalya combines Amalya half part and satirizing part. Next formulation is Kandulodaka, which is the subtype of Hema formulation, explained by Acharya Sharangara. Kandulodaka is a fish, Kashai Madhura and Rasa, and that is the way it is basis for Prasadana Karma. According to Ashtanga Hridaya, Madhura Amla and Lavan rest controls water, Tikta Katu Kashai rest controls Kapha, Kashai Tikta and Madhur rest controls Pitta, as we all know. According to Doshabala, the appropriate Ahara and Aushadhi yogas have to be applied to treat this disease. Conclusion includes the treatment is based on the principles of Hetu Viparita, which provides considerable relief in dharma. Appropriate usage of guna doshas, Hetu, and its role in Samprapti Vegatana plays an important role in the output of the treatment. The combined effect of Sodhana Chikitsa, Shamana Chikitsa, with Sthanic Chikitsa in the form of Lepa is advised, and Nidan Parivarjana should be followed. Thank you.
Thank you, doctor.
Thank you, Dr. Thank you, Dr. Sonali. Next, I invite Dr. Aishwarya Mureshwar for the paper presentation.
Hello.
Yes, doctor, you're audible.
Yes, I'm going to share my screen. Okay, is it audible? Are you seeing my screen?
Yes, it's
Doctor.
visible.
Okay, so I'm starting my presentation. Hello everyone, good evening. Myself Dr. Aishwarya Mureshwar Dhule. I am presenting my paper presentation on role of Ayurveda in occupational health. Abstracts. Occupational health practices, otherwise known as health safety practices, encompasses all activities geared towards ensuring workers' safety and well-being in all occupations. In the recent time, the traditional Indian therapy of Ayurveda is gaining popularity in the both Indian and the worldwide. This communication emphasizes an occupational disease and hazards in the industry and explains the Ayurvedic treatment, dietary regimen, Ayurvedic dincharya, and techniques for increasing the general strength of the persons affected by the occupational hazard. There can be many more diseases such as stress, heart stroke, tinnitus, COPD, dryness of eyes, pain of the different types, etc. Then the introduction. Health play an important role in the day-to-day life of huge population. Workers represent the half of the world's population and are the major contributors to the economic and social development. People are predisposed to various diseases based on their way of life, living and occupational habits. They are preventable and can be lowered with the changes in the diet, lifestyle, and the environment. Workers may not get a healthy food due to the shift duty continues for 8 to 12 hours. They may suffering from disturbed sleep, stress, anxiety, etc. Occupational health practices, otherwise known as health safety practices, encompasses all activities geared towards ensuring workers' safety and well-being in all occupations. In the recent time, the traditional Indian therapy of Ayurveda is gaining popularity in the both Indian and worldwide. As I say, Ayurveda is an ancient science which covers all the preventive and curative aspects of the health disorders. The aim to study the role of Ayurveda in occupational health. Objectives: first, to study the effect of a Sabrita, Dincharya, Ritucharya, Panchakarma, Dharnya Vegas, Rasayana, Achar Rasayana in occupational health. And the second most, to study the correlation of the Ojasa, material and methods, literature of Ayurveda textbooks, modern textbooks and net surfing, research papers and the article from the journals. Preventive measures. In Ayurveda, good conduct is called as a Sadhvita. The code of a good conduct is explained. It describes about the rules that are to be followed by which we can acquire good health. The rule of a good conduct has been mentioned in the Ayurvedic text of some of them are related to the social, emotional, psychological, and ethical aspects of the life. Sadhvrita can be classified as a personal, social, psychological, emotional, and religious and occupational conduct. Primary prevention is accomplished by reducing the risk of diseases in the occupational setting. This is the most commonly done by reducing the magnitude of exposure to hazardous substances. As the exposure is reduced, so the risk of adverse health consequences. Other method of exposure reduction includes use of personal equipments and rotation workers through to area in which hazards are present to reduce the exposure to the each workers. Curative measures. Secondarily, prevention is by identifying the health problem before they become clinically apparent and intervening to limit the adverse effect of the problem. This is also known as occupational diseases surveillance. Tertiary, prevention is accomplished by minimizing the adverse clinical effect of the health of a disease or exposure. Typically, this is thought of as a clinical occupational medicine. An example of a tertiary prevention is the treatment of COPD, anthracosis, sinusitis, coal mine dust, lung diseases, TB, etc. The goal is to limit the symptoms, discomfort, minimize the injuries to the body, and maximize the functional capacity. And the emotional disorders like kama, krodha, bhaya, shoka, nirlajja, atiraga, hirsha, abhidya, etc. are caused by the pradnyaparad, and it is a major cause of causing the any diseases. It interrupts the social and mental conduct of a person. Wrong social conduct is the basis of the most psychological and many physical diseases. Therefore, this factor has to be avoided as it to be measures cure to be upcoming diseases. Promotive measures. In the management of occupational diseases, Ayurveda offers various regimens including Dinacharya, Ritucharya, Panchakarma, Dharaniya Vegas, and Rasayanas therapies, and also the Sadhavrittas and the Achar Rasayanas, Ahara and Vihara are the utmost important to maintain a healthy and happy physiological perspective. First, we will see the Dinacharya. It is very important to follow the daily regimen in day-to-day life to maintain the biological clock, which leads to happy well-being. Ayurveda suggests to being daily habits with the early rising, avoid suppression of a natural urges, and the eliminate waste as per keep the teeth clean, regularly daily bathing, etc. If we do not follow daily regime, take bath, etc., then the people starts avoiding you and regarded as low-grade community. This hampers the relation in between the society and the leading the psychological disorders like anxiety, stress, etc. So follow the dincharyas. Then we see Ritucharya. Ritucharya represents a very important aspect of preventive measures for the various illness, including occupational disorders, as mentioned in the text. As Acharya says, seasonal changes and follow regimens explained according to seasons, if not, may leads to psychosomatic disorders. Ayurveda advises seasonal panchakarma as preventive measures for the maintenance and the prevention of a physical as well as a mental. As a going Vasanta, they do a Vasantik woman. Then we see Dharnya Vegas. Dharnya Vegas are those urges which are to be restrained, and Adharnya Vegas are those urges which are not to be restrained. The urges that to be restrained are immediately related to the mental hygiene and are called as the Dharnya Vegas. The wise man should control the impulses of emotional factors like grief, fear, angry, jealousy, excessive attachment, and the malice. Otherwise, if they cross the boundary of a normalcy, they will be the best of so many mental disorders. This concept of Dharnya Vegas is properly followed will lead to proper mental health. Then we see rasayanas. Rasayana can be used as a nutritional supplement as well as a medicinal depending upon its various types. Most rasayana produces their nourishing and rejuvenating effects by promoting the Agni Bala. Also, rasayana acting as a direct nutrient and by way of a strota prasadana, resulting in an improved nutritional status, which further leads to an improved quality of a body and rejuvenative supplements. Then we say Achar Rasayanas. Some of social conduct and the behavior will be endowed with all qualities mentioned in Achar Rasayanas therapy. Person attains the effects of regenerate therapy, one who are truthful and free from anger, devoid of alcohol, who are peaceful and pleasing in their speech, who practices japa means mantra and cleanliness, who are a dhira, dharya, who regularly practices charity and tapasa, also whose period of awaking and sleeping are regularly, who are free from ego, whose conduct is good, whose are not narrow-minded, whose have love for spiritual knowledge, having self-control, and who regularly study their Dharma Shastra, get the best of the rejuvenation therapy. Then we see the Ojasa. The immunity and overall strength of the person can be increased by the Ayurvedic dietary advices and the lifestyle changes. This overall strength is called as ojas according to the Ayurveda. It is well known in common life that some people are more affected by diseases, while some are less affected. This is due to the inherent strength and the lifestyle which a person follows. It also assists in minimizing the occupational hazards. People who are affected due to the occupational should be routinely checked and take a proper diet and undergo panchakarma therapies for cleaning of the body. Also, Ayurvedic Dinacharya take rasayana, that is for increasing our inherent strength, that is ojasa according to Ayurveda. When ojasa of our body diminishes, then you may feel low due to the ojakshaya and are unable to do any work. Stiffness in the body, heaviness, swelling, discoloration, laziness, etc. are the symptoms of the ojakshaya, which are commonly found these days. Fainting, emancipation, delirium, etc. are also the symptoms of ojakshaya. Two types of ojakshaya are described in Ayurveda. One is the heart and the other is the whole body. We should try to increase this ojasa so that we are least affected by the occupational hazard. If we are physically and mentally strong, then these things will least affect us. So our emphasis should be also an improving general health of the employee so that they are least affected by the occupational hazards. Then the discussion. Occupational diseases may occur after the termination of the exposure. The clinical manifestation of occupational diseases are related to the dose and the timing of exposure. Occupational factors can act in a combination with the non-occupational factors to produce the diseases. Protection and the promotion of the health of our workers by preventing and the controlling occupational diseases and the accident by eliminating the occupational factors and the conditions hazardous to the health and the safety at the work. The enhancement the enhancement of the physical, mental, and social well-being of our workers, and the support for the development and the maintenance of their working capacity as well, professions and the social development at the work, enabling workers to conduct the social and economically productive life and contribute to positively sustainable development. Then we held to the conclusion. In this presentation, I have elaborated the use of Ayurveda for decreasing the intensity of the occupational hazard by changing the lifestyle and dietary patterns of the individual involved in the different type of the occupation. Ayurveda has always emphasized to maintain the health and prevent the diseases by following proper diet and lifestyle regimen rather than the treatment and the cure of the diseases. For this purpose, Ayurveda has explained social and the under preventive, curative, and promotive aspect. The psychic, emotional, social, and behavioral changes are also responsible for the producing psychosomatic disorders. Ayurveda has explained code of good conduct under the Sadvrita. By following them, individual is able to maintain physical, mental, and social health and able to socialize with the society. Panchakarma therapies are also explained to control occupational hazard. Although the occupational hazard cannot be totally cured because of causative factors, cannot be completely eliminated, but some help can be given to the individual suffering from the occupational hazards by using these therapies, dietary advices, and the lifestyle changes. Therefore, the Ayurveda should be included in offices, industries, and the other workplace to curb the menaces of the occupational hazards. Then the references are here. Thank you so much. Care and more with Ayurveda. Thank you.
Thank you, Dr. Aishwarya. So next, I would like to invite
Dr.
Dr.
Preeja Vijay Kumar.
Preeja Vijay Kumar.
Dr. Preeja, are you there? Hello,
Hello,
Dr.
Dr.
Preeja, are you
Preeja.
there? Okay, next I invite Dr. Neha for the paper presentation. Hello, Dr. Neha Dattaram for the paper presentation. Dr. Neha, are you there?
Yes. 1 minute.
Okay, doctor. Okay.
Paper presentation. Is my screen visible? Hello?
Doctor, your screen is visible.
Okay.
Can you please mute another Zoom connected device, doctor?
Yes. Hello. Good evening, everyone. Myself, Dr. Neha Mhatre, PG Kaichikasa second year student, PhD Ayurveda Mahavidyalaya, Wagoli, Pune. Today, my topic for presentation is review on Pathya and Apathya in management of Sthaulya. Abstract. And industrialization and communication advances, sedentary lifestyle are becoming more prevalent and are linked to chronic non-communicable diseases like diabetes, hypertension, cancer, etc. Preventing obesity will lower the risk of acquiring various diseases since it is one of their risk factor. Sthaulya is the closest clinical entity in Ayurveda to obesity and overweight. The idiopathogenesis of obesity is caused by an excess intake of calorie combined with a decrease in expenditure. In Ayurveda, Pathya and Apathya are given specific attention in terms of Ahar, Vihar, and Mansik entities so that the ailment can be treated holistically. When these guidelines are followed, the treatment yields a better result. And in the management of Sthaulya, this presentation attempts to review the Pathya and Apathya of obesities. Introduction. Obesity can be viewed as first wave of defined cluster of non-communicable diseases known as New World Syndrome, which is causing a massive socio-economical and public health burden in developing countries. The prevalence of overweight will be more than double among Indian adults aged 20 to 69 years between 2010 to 2014, while the prevalence of obesity will be triple. Since obesity is such a growing concern and potential havoc creating bombshell, it becomes really important to study this disease deeply. Acharya Charak has described Sthaulya is one of among the Ashtanindis and Santarpan Janit Roga. Ayurveda has emphasized on dietary and overall lifestyle changes along with medicinal use for management of Sthaulya.
In current era of fad diet, it is important to know about Ayurveda's perspective regarding diet, as Ayurveda has more potential to prevent and manage disease and maintain overall health. Material and methods. All the information about Ahar, Vihar and Mansik entities in terms of Pathya and Apathya for management of Staulya was compiled from several Ayurvedic Samhitas. The review on recent publication about Staulya is done from scholarly database like PubMed and Google Scholar. Aims and objective. To explore various Pathya and Apathya described in Ayurveda for management of Staulya Vyadhi. To establish Aharaj, Viharaj, Mansik, Pathya and Apathya for Staulya in easily understandable manner. Result. This table shows Pathya and Apathya in terms of Ahar. First वर्ग is Shukadhanya. Pathya for Shukadhanya is Yava, Kodra, Puranshali, Raktashali, Shashtikshali, Priyangu, Laja. Apathya is Godum, Navanna, Shali. Second class is Shamidhanya. Pathya is Mrudga, Rajamasha, Kulatha, Chanak, Masur, Nishpav. Apathya is Masha, Tila. Shakavarga, Karavellak, Patola, Patrashak, Shikru, Runtak, Trapushpa, Ervanuk, Adrak, Mulak, Garjan, Lashun, Nimbapatra. Apathya is Utpal Kangari, Kasamarda, Palandu and Alu. Falavarga, Kapitha, Jambu, Amalaki, Bibitak, Haritki, Marich, Pipali, Bilvafala, Erenda Karkati, Ankol, Badar, Dadim, Vrukshambla. And Apathya is Brudvika, Karkandu, Panas, Vatam, Shleshmantak, Ankot, Karjur, Narikel, Priyala, Balambra. Next varga is Dravya varga. Apathya is Takra, Madhu, Ushnodak, Asav, Arishta, Jirna Madhya, Shruta Shita Jala, Panchakola Shruta Jala, Shunti Siddha Jala. Apathya is milk preparation. Next is Mouse varga. Pathya is Rohit Matsya, Jangal mouse. Apathya is Anupa, Audak, Gramya mouse. In Ikshu varga, Apathya is Ikshu and Ikshu Vikar. Tela varga. Pathya is Tila Tela, Sarshap Tela. And Apathya is Priyala Tela. औषध वर्ग पथ्य शिलाजतु लोह भस्म अग्निमंथ हिंगू मरीच पिप्पली एरंड एंड अपथ्य समुद्र लवण क्षीर वर्ग पथ्य अविक क्षीर उष्ट्र क्षीर अपथ्य गोक क्षीर महिष क्षीर हस्तिनिक क्षीर दधि घृत इन मधु वर्ग पथ्य मधु मूत्र वर्ग पथ्य गोमूत्र इन मध्य वर्ग पथ्य जगल आरिष्ट मधु and Amlakanji and Apathe Sura, Gonda and Madhulika. This is Pathya and Apathya in terms of Vihara. The Pathya is Shrama, Vyayam, Ushnodaka Sevan, Prajagar, Brahman, Rohan, Upavasa, Ashwahasti Rohan. Apathya is Shitala Jala Sevan, Diva Swapna, Avyavai, Ati Asan, Asan Sukha, Sukha Shaya, Swapna Prasanga. Pathya and Apathya in terms of Mansik Nidan. Pathya is Shuka, Chinta, Bhaya, Krodha. Apathya is Nitya Harsha, Achintan, Manaso Nivrutti. These are some important points about diet. It is good to consume little less quantity of food which facilitate the action of Pachat Pitta, which will help to control formation of ama. Excessive consumption of food is called as Ati Matra Ahar Sevan. Here the consumption of food is related not only for quantity of intake but also the frequency of intake. As the formation of rasa is more, it overnourishes the dhatu of the body, leading to staulya. Since diet which aggravate kapha also contribute formation of ama, dairy products, oily food items, salty and sour food products should be avoided. Most of the vegetables are good to reduce the formation of kapha as well as ama. However, they should be consumed warm and along with some spices to counteract their nature. It is better to avoid excessive water intake after consuming food as it interferes with the concentration of digestive enzymes and slows down digestive process. Person must be realizing that prolonged dieting is necessary for following a restricted diet regime, ensuring optimal weight loss. Discussion. In modern era, all people regardless of gender are working to earn their pleasure, which has put them under stress, strain and tension. They are also knowingly and intentionally related the idea of healthy habits in their day-to-day lives, which has led them to developing lifestyle disorders like staulya and its complication. Acharya Charaka has stressed upon use of Guru and Apatarpan drug as a special regimen for staulya chikitsa. Ayurveda has given importance to Agni Avastha, Guna, Rasa and Grahan Vidhi of Ahar rather than just calorie counting explained in modern medicine. Commentator like Chakrapani Gangadhar had mentioned that Alpa Bhojan are the best method for Karshan. Conclusion. Pradnya Parat Asatma Indriyartha Sanyog and Parinam are three root cause of disease, which are a result of faulty lifestyle, especially consuming Mithya Ahar and Vihar. Faulty lifestyle include not following Dinacharya and Ritucharya, holding non-suppressible urges and not restraining the suppressible urges, not obeying dietetics rule, a lack of exercise, and failing to strike the balance between eating, resting, sleep, and physical activities. The effective management of Staulia can be achieved by simultaneously treating all its contributing factor by medicinal treatment along with the dietary and habitual regimens. In India, both under and overnourished nutrition are on rise. It is crucial to talk about diets, pursuit, and way of life that could prevent this ailment. Hence, in Staulia, better health is achieved by avoiding apatya and embarrassing appropriate pathya. These are the references for my study. Thank you.
Thank you, doctor. Next, I invite Dr. Amar Lahuraj for the paper presentation. Dr. Amar, are you there?
Yes.
Okay, doctor. Please share the screen, doctor.
Wait a minute, sir. I will share.
Okay.
Sir, can you please share my slides? I can't share from my side.
Okay, doctor. 1 second. I will share for you.
Close for slides. Yes, sir. I can share my slides now.
Okay, okay, doctor. Please continue, doctor.
Yes. Are you visible? Am I visible too? My slides are visible? Hello.
Yes, doctor. Visible, doctor. Please continue, doctor. Please start the session.
Am I audible and my slides are visible?
Yes, doctor. Yes.
Yes. Good evening, everyone. Myself, Dr. Amar Lauraj Sabne, MD Kai Chikitsa, scholar second year, from BSDT Ayurveda Mahavidyalaya, Wagholi, Pune. My topic for today's presentation is review on Patha Patta in the management of Amla Pitta Vyadhi. Here is the abstract. Agni, Prakriti, Ahar and Vihar are given top priority by the fundamentals of Ayurveda in preserving health. People in the current period adopt improper eating and lifestyle habit as a result of their commitment to various jobs, which is the most common cause. The most prevalent hurry, worry, and career ailments are GIT disorders, which adversely influence social and emotional well-being in addition to physical health. GI disorders explained by modern science resembles with Amla Pitta according to Ayurveda. Amla Pitta is a fairly prevalent condition with symptoms like Amlodgar, Tiktodgar, Rudakanta Daha, etc. that is brought on by Vidagda Pitta. Yava, Godhum, Puranshali, Mudga, Yusha, Lajasuktu, and other pathyas are advised in Amla Pitta. Hence, Navanna, Avidugda, Masha, Kulatha, Dadi, and other apathyas are also advised in Amla Pitta. Thus, this presentation highlights on Pathya and Apatya in Amla Pitta. Introduction. One of the most prevalent illness in the current period is Amla Pitta. Pitta aggravation is the main cause of it. It is getting worse every day as a result of stress and changing lifestyle. It can be connected to gastritis, hyperacidity, APD, that is acidic peptic disorders in modern science. Prevalence survey indicates 50% of the population is impacted by Amla Pitta. Antacids are frequently used in modern treatments. Ayurveda has a major focus on disease prevention rather than disease prolonged. In Ayurveda, Patha Patta is used to treat and prevent the disease. Aims and objectives. To elaborate and explain Patha Patta in the management of Amla Pitta. Materials and methodology. Information collected from various sahitas like Bhaisaj Ratnavali, Bhavprakash and Madhav Nidan regarding the Patha Patta of Amla Pitta. Also, information collected from recently published articles, journals, and e-journals. Now comes to Hetu. Eating habits include Viruddha, Dushta, Amla, Vidahi, Pitta, Prakopak Ahar, Adhyashan, Pishtanna, Madhya Sevan, and Atyambu causes Amla Pitta. Viharjanya causes Divasvap immediately after eating. Some manas bhavs like krodh, shok, bhaya, chinta, etc. causes amlapitta. Lakshanas includes avipak, klama, utklesh, titka, amlodgar, rudhakanta daha, aruchi, and gaurav. Here is the samprapti. Tridos prakopak agnimandya. On continue taking diet of viruddha ahar causes amlapitta. Here is the list of pathya dravya. First, Anna Varga, Purana Shali, Yava, Godhu, Mudga. Shira Varga comes to Godugda. Shaka Varga, Patola, Kushmanda. Mansa Varga comes to Jungle Mouse. Phala Varga, Dadima, Amalki. After that comes to Apathya Dravya. Anna Varga causes Navanna, Masha, Kulatha, Taila. Jala Varga, Dushti Jala, Shita Jal. Madhyam Varga, Nava Madhya. Aloka. Shira Varga comes to Dadhi, Avikshira, Navaguda. These are the apathyas found in various Ayurvedic Samhitas. Things to be avoided in Amla Pitta are: avoid using too many spices, peppers, and other irritating ingredients in your foods. The diet should be consumed to control the production of Am in order to help the action of Pachak Pitta. Ama forming items like dairy products, fatty foods, salty foods, and foods with a sour or acidic flavor should be avoided. Consumption of Viruddha Ahar should be strictly avoided. Excessive drinking of water after eating should be stopped because it interferes with the concentration of digestive enzymes and slow down digestion. Alcohol, tobacco, tea, and other drug addictions, which are exacerbated factors and have a significant part in the etiology. Here comes to discussion. Healthy foods and beverages, if consumed excessively, leads to serious effect causing apatya. The importance of drug therapy is negligible if a person follows Pathya guidelines for a certain condition, while drug treatment is totally worthless if a person is subjected to apatya. The Pathya Sevan has been mentioned in Vedas as significant as Aushadha Sevan and an effective measures in disease prevention and disease complication prevention. The daily consumption of a food rich with Yava, Godhum, Puranshali, Mudgayush, and Lajja Shaktu, having actions such as Dipan, Laghu, Pittahar, and Vatanoloman, which are opposite of Ama and Pitta, can be prescribed for Amla Pitta. Due to the affordability and accessibility of these Pathyakar Dravyas, they can be recommended for regular uses. Help to maintain Pitta normal level and preventing the development of Ama and Vidagdha Pitta Prakopa of Amla Pitta. Conclusion. No medication is similar to food according to Ayurveda, and a person can become disease-free by following a healthy diet. Ayurveda does not consider Amla Pitta as a condition that can be cured with only medication or by dietary changes. Ayurveda emphasizes on enhancement of the digestive power as a major component of curing Amla Pitta. Even though it is true that it is a yapya, not curable, not completely curable or difficult to cure disease, consistent use of the above mentioned Pathya combined with the recommended treatment method would not only make a person free of Amla Pitta, but also improves their health so that they can live a long life. Here are some references. Thank you.
Thank you, doctor.
Thank you, Dr. Amar.
Next, I invite Dr. Neha Gopal for the paper presentation. Dr. Neha, are you there?
Yes, sir. Are you audible,
Okay,
sir?
doctor. Audible, doctor. Please share the screen, doctor.
Can you please share my slide?
Okay, 1 second, doctor.
Yeah. Hello.
Hello, doctor. Can you send me your PPT, doctor?
Shall I share my screen slide on screen?
Okay, you
Hello.
can share, doctor. You can share your
Yes.
screen, doctor.
My screen is visible, sir?
Yes, doctor, visible. Please start, doctor.
Okay, myself Dr. Neha Babar, PG scholar, in the Department of Kachekesa from BSDT Ayurveda College. The title of my presentation is Role of Siraved and Shaman Chikitsa and Pathyapatya in the Management of Ekakushta in Stavvikar Case Study. Abstract. A dietary and lifestyle irregularities cause many diseases like skin disorder, diabetes, hypertension, obesity, cardiovascular disorder, etc. The dietary intervention and lifestyle modification to prevent and help in curing the diseases. It has been established fact that a common cause of various skin disorder is altered ahara vihara, especially viruddhahar. Acharya Shushrut has described a Sira Veda as a half of the therapeutic measures in the Shalyatantra, like a Basti Karma in Kaya Chikitsa. Sira Veda produces Indriya Prasadan and Dhatu Stirata, hence Rakta Dhatu Dushti and Rasa Dushti in Ekakushta is reduced and Tvakendra is nourished. In present case study, a 4-setting of Sira Veda has been done with its shaman, chikitsa, and dietary modification to improve the skin texture. Introduction. Currently observed that the sedentary lifestyle and rest work schedule has increased the number of skin disorder. Kushta is one of the chronic skin diseases which is caused due to improper dietary habit like viruddha ahara, avyayama, anidra, divaswap, and chinta, etc. Ekakushta is a type of Shudra Kushta occurring mainly due to the imbalance of Vata and Kapha doshas, resembling the psoriasis in its clinical manifestation. Acharya Charak explained the Shodhan and Shamana Chikitsa for Kushta along with other medication. Raktamokshan is one of the Shodhan Chikitsa for Kushta. And psoriasis is a long-lasting autoimmune and chronic inflammatory skin disorder clinically characterized by erythematous, sharply demarcated papules and rounded plaques covered by silvery miscanthus scales, predominantly affecting the skin of elbow, gluteal cleft, knees, and scalp. Steroid creams and antifungal and anti-inflammatory PUA medication are the main treatment of psoriasis. In modern treatment, the modalities are immunosystem suppressing medication and not derived from a great complication, mainly in long-term use of UV light may associated with an increased incidence of non-melanoma and melanoma skin cancer. In Ayurvedic text, there is a wide description of skin disorder described under a single term Kushta. Ekakushta has been mentioned under the heading of Shudra Kushta, and the main clinical feature of Ekakushta are as follows: Asveda, Mahavastu, Matsya Shala Loma. These clinical features are similar to that of psoriasis, and owing to this fact, the psoriasis is correlated with Ekakushta in this case study. Aim to study the effect of Siravet, Shaman Chikitsa, and Pathyapatya in the management of Ekakushta. Objectives: to observe the change of symptoms of Ekakushta after Siravet and Shaman Chikitsa, and to observe the changes of symptoms of Ekakushta after Patya and Apatya. A 60-year case study, a 60-year-old male came to OPD with a complaining about Mukha, Karna, and Manya Pradeshi Araktavani Tvakvaivanya, Ubhay Karpura Pradeshi Araktavani Tvakvaivanya, Kandu, Rukshata, and Malavibandhata since 8 to 9 years. And present history, a patient was asymptomatic 10 years ago. Then the onset of symptom includes in the form of small vesicles associated with itching. Later on developed pidaka and reduced discoloration. After some days, itching was gradually increased with dryness, and patient received some oral steroids, antifungal, anti-inflammatory drugs from local dermatologists and diagnosed with the psoriasis, but he didn't get relief. The patient came to OPD with about the complaints. After all the clinical examination and history, the patient was diagnosed with Ekakushta. Past history, there is no any past history, no any allergic history. Family history, it's not significant. Personal history, having ahara chetu, in ahara chetu, sweet products, pickles, ice cream, oily food, papad, etc. In Guru, there is a paneer and curd. In having ushna, tikshna, spicy food was in the diet. Vihara Jetu, lack of exercise, physical inactivity or inadequate. Manasa Hetu, stress, given depression. On examination, the systemic examination, there's no any systemic examination. Pulse is 76, your BP is 120 to 80 mm of Hg. In Ashtavida Pariksha, this Mala is Baddhata, Mutra is Prakruta, and Jiva is Ishasam, Shabda is Pashta, Sparsha is Ishat Ushna, Druka is Upanetra, Akruti is Madhyam. In Samprapti Ghataka of the Ekakushta dosha, it is a Vatkafa dosha prakopa, Dusha, Rasarakta Mams Lasika, and Srotasa, Rasavaha, Raktava, and Mamsava, in Srotodushti, Sanjay Vritti, Udbhavstan, Tvakani Mamsa, Vyaktastan, Mukha, Manya, Ubhay Kurpur Pradeshi,
and Rogamarga, it is Abhyantar and Upadravis Kandu. Samprapti, Hetu Sevan, it leads to Tridosha Prokoi, mainly Tridosha Kofodosh Prokopus mainly, and there will leads to the discoloration of skin, dryness of skin, itching, and discharge from affected area. That may leads to Kushta. The treatment plan in this patient, considering the psoriasis as Ekapushta following Ayurvedic management plan, was administered first is Rakta Mokshan. According to the course of the disease and involvement of Vata, Pitta, and Kapha dosha, Rasa Rakta Dhatu, Tvaka Dushti, and Sharira Manasa Bala of the patient, the Siravet Karma was planned. Then Siravet Karma did from right hand median cubital vein of the patient, and the Siravet Karma done 4 times with the interval of every 7 days, and each time 20 ml blood was removed. In Shaman Chikitsa, the drug used in the patient are as follows: Arogya Vardhini 250 mg for 3 weeks, Amalkivati 250 mg for 3 weeks, and Nimbatil for the local application for 3 weeks, and Yashtimodi Grut for the local application for 3 weeks. In Apatya given to the patient is avoid dadi and its combination with foods like dahi vada and custard, oily or spicy food, bakery products in that biscuit, khari and toast, viruddha, milk and milk combination together like custard and milkshake, milk and milk product like paneer in that. In Pathya, Lagu and Supachahar, in vegetable is Karvela, Padbada, Garlic, Chakvat and Vrantaka, Mudga Yush, Yavagu Seva and Shunti Siddha Jal. In Vihara, Vyayam or regular exercise in that brisk walking, skipping and stepping. Pranayam and meditation in that Anulom, Vilom and Brahmari and Om chanting. Do not hurry while taking milk. Next is avoid use of soap or detergent at affected skin or after bath. Dry the body. Affected skin should be let wet. Avoid a day slip. In discussion, the twerk vikar are commonly occur due to improper dietary habits and altered lifestyle. As diet and lifestyle affect the digestion and metabolism, proper rasati dhatu formation in tissue nourishment and formation. Siraved act on predominantly in Pitta, Rakta and Kafaja Vyadhi, or when Pitta or Kafaja is in Anubandha to Vaddosha. In Arogyavardhini Vati has a Tikta Ushna gun which helps in Vata Shamana. It mainly acts as Deepan Pachan, Pathyakar. It is describing Kushthanashaka. Nimbate has Tikta Rasa used in Kandu Nashaka. It acts as an Twacha used in Kushthanashaka and Rakta Shodhaka. Yashtimodhu Grut act as a Pitta Kshamaka, also possesses Snigdha Gun which helps in Vata Shamana. It includes in the Varnya Gana, and Amal Kaviti has all six rasa except a Lavan Shita Virya act on Deepana, Pachana and Anuloman properties. Clinical findings of patients since before and after. Conclusion: skin diseases are very common in today's era. Along with the dosha dhatu tushti, poor hygiene is also one of the causes of skin diseases. The present case study concludes that the use of Ayurvedic medicines along with the Siravet Karma and Pathya Apatya can minimize the symptoms in early stages and cure the diseases. These are the references mentioned below. Thank you, sir.
Thank you, doctor. Let's invite Dr. Yashasri Ravindra Davare for the paper presentation on the topic Pradishaya. Dr. Yashasri, are you there?
Yes, sir. Am I audible, sir?
Okay, doctor.
Am I audible, sir?
Audible, doctor. Please share the screen, doctor.
Just a moment, sir.
Okay.
Is my screen visible, sir?
Yes, Dr. Visible, doctor. Please start.
Good evening, everyone. Very good evening, everyone. I am Dr. Ravindra Davare, PG student of Shala Ketantra Department, SST Ayurvedic College, Sangamner. Today, I am going to explain the disease Pratishay in brief. Definition of the Pratishay. Vatam prati abhimukham shayo gamanam kafadinam yatrasa Pratishaya. Pratishaya means prati, that is The word Pratisha is made up of two words. Prati means in opposite direction and Shaya means flowing of secretion. And Pratikshanam Shayati iti Pratishayam. This is the quote of Dalan. The disease in which there is a continuous flow of secretions through nose is called Pratishaya. Importance of Pratishaya. Pratishaya is the causative condition for all the nasal cavity disease, and so it is explained with the priority in Nasa Rogal. Pratishaya bhavet kasa, kasa sanjayate kshaya. If not treated at the right time, it will lead to kasa and eventually to kshaya vyadhi, which causes the further complications leading to irreversible conditions. The samprapti is hetu sevan. Hetu sevan leads to vata prakop. Vata prakop causes the stagnation of all the vitiated doshas. Again, if hetu sevan occurs, pratishaya occurs. The main types described by acharyas are Vataj Pratishay, Pittaj, Kafaj, Sannipatik, and Rakta. The causative factors can be divided into three main categories: Vihar, Ahar, and other factors. The Vihar includes Raja Sevan, that is staying in impure air for a long time, too much sleep or no sleep when required, working in extreme hot or extreme cold conditions. The Ahara includes drinking too much water, drinking too hot or too cold water, consuming excessive Guru, Madhur, Sheet, and Ruksha Ahar, excessive use of cold drinks, and the other factors which include the psychological factors like stress, anger, vague vidaran, especially obstruction through the natural urges like urine, stool, and sneezing. Clinical features can be divided into Purvarupa symptoms and the signs which we observe. Purvarupas are headache, heaviness of head, sneezing, congestion in the nose, increase in the secretions in the nasal and the oral cavity, and change in voice. The symptoms are increased headache, abnormalities in the smell sensation, that is anosmia or hyposmia, body ache, excessive thirst, nasal obstruction, and throat irritation. The signs which we observe are increase in nasal secretion, burning sensation and inflammation in nose, and fever. The examination of patient can be done. Local examination, we can observe the nasal secretions, nasal if there is any nasal obstruction or not, and what is the condition of the nasal mucosa, whether it is congested or not, or how much congestion is there of the nasal mucosa. The investigations can be done like hemogram and the plain X-ray of nose and X-ray of the paranasal sinuses. The treatment can be mainly divided in two stages, Amavastha and Pakvavastha. In Amavastha, we give Svedan, that is Nari or Upnas with Dhumapan. Ahar we should give Amla and Amla Dravayukta Ahar. And in Pakvavastha, Vritapan is indicated. And after that, Svedan, appropriate Vaman Virechan and Asthapan Basti and Shiro Virechan is given. Internal medicines, according to Ayurveda, Vyaushadhi Vati, Marichadi Yog, Chitra Kharitki. Many more are there, but I have highlighted just only these three. And in comparison to Pratishay, we can discuss rhinitis according to allopathy. Rhinitis is the inflammation of nasal mucous membrane. It is mainly divided into infective and non-infective categories. In infective, it is acute and chronic. And in acute and chronic, both specific and non-specific stages are there. And in non-infective, we can give it allergic and vasomotor. In allergic are seasonal and perennial. The causative organisms are rhinovirus, influenza virus, and adenovirus. If secondary infection is caused by bacteria, these bacteria are Streptococcus hemolyticus, Pneumococcus, Staphylococcus, Haemophilus influenzae, and the spread is through by the direct contact and by airborne droplets. The clinical features are burning in nasopharynx, irritation and dryness in nose, sneezing, shivering and malaise, rhinorrhea, blocking of nose, mucosa becomes hyperemic, anosmia, fever and headache. And the treatment according to the modern therapy is analgesic and decongestants, antibiotics if the secondary infection occurs, antihistamines, decongestant drops, steam inhalation and rest. Thank you so much, Doctor, and all delegates for kind cooperation and listening to my presentation. Thank you so much.
Thank you, Dr. Ajasri. Next, I invite Dr. Indu PV for the paper presentation. Dr. Indu, are you there?
Yes, doctor.
Okay, doctor, please share the screen, doctor.
Okay.
Screen is visible, doctor. Please start.
Good evening to all. Welcome to the presentation. The topic of the presentation is Dying Declaration and its validity in legal system. I am Dr. Indo PV, second year PG scholar, Department of Agatantra, VPSC Ayurveda College, Kottakkal. Dying declaration is a legal concept, refers to the effect that the statement which is made by a dying person explaining the circumstances of his death. A person who is about to die would not lie. Truth sits on the lips of a person who is about to die. Dying declaration is a written or oral statement of a person who is dying as a result of some unlawful act relating to the material facts of cause of his death or bearing on the circumstances. Section 32 of Indian Evidence Act, a close scrutiny of Section 32 of Indian Evidence Act. It is vividly known when the statement is made by a person with regard to the cause of his death or any of the circumstances of the transaction which resulted in his death, in cases in which the cause of that person's death comes into question. Such statements are relevant irrespective of the person who made such declaration was expecting death or not. Thus, it is apt to say that admissibility of dying declaration is explained in the Section 32 of Indian Evidence Act. The statement should relate to the cause of his imminent death or any of the circumstances of the transaction resulting in his present condition. Such declaration is admissible in court when the cause of that person's death is the subject of inquiry. It may provide useful information and help to obtain justice. A person who is accused of a crime cannot make a dying declaration, but only a person who is the victim of a crime. Statements unconnected with the actual crime are not admissible in a dying declaration. It is believed that a person who is about to die will speak only the truth. A dying declaration has the same measures of worth as that of a statement made on oath in the court. The law does not provide who can record a dying declaration, nor is there any prescribed form, format, or procedure for the same. It has been incorporated in Section 32 of Indian Evidence Act. A dying declaration is valid even if the declarant lives for some days after making the declaration, but in that case, it may be relied on only as corroborative evidence. How a dying declaration should be. There is no particular form of dying declaration. However, the best form of dying declaration is in the form of questions and answers. Whenever a dying declaration is being recorded in the form of questions and answers, precaution should be taken that exactly what questions are asked and what answers are given by the patient, those should be written. A dying declaration may be in the following forms: written form and verbal form. Gestures and signs form. If the injured person is unable to speak, he can make dying declaration by signs and gestures in response to the question. If a person is not capable of speaking or writing, he can make a gesture in the form of yes or no by nodding, and even such type of dying declaration is valid. It is preferred that it should be written in the vernacular which the patient understands and speaks. A dying declaration may be in the form of narrations. In case of a dying declaration, is recorded in the form of narrations, nothing is being prompted and everything is coming as such form of the mind of the person making it. Next is the procedure. If there is a time, executive magistrate should be called to record the declaration. The doctor should certify that the person is conscious and his mental faculties are normal. That is, he is in compos mentis. Oath is not administered because of the belief that a dying person tells the truth. No leading questions are asked. When the death is imminent, the statements may be recorded in the presence of two witnesses by the doctor or the police officer without losing time in waiting for the magistrate. Statements of the declarant should be recorded in the form of simple narrative without any alteration or phrases. While recording the statement, if the declarant becomes unconscious, the person recording it must be record as much information as he has obtained and sign it himself. If the dying person is unable to speak but able to make signs in answer to questions put to him, this can be recorded and it is considered as a verbal statement. Fitness of the declarant to make statement is certified again at the conclusion of the statement. Declaration is sent to the magistrate in a sealed cover. If the declarant surveys, the declaration is not admitted but has corroborative value and the person is called to give oral evidence. Who may record dying declaration? It is best that it is recorded by the magistrate. If there is no time to call the magistrate, keeping in view that deteriorating condition of the declaring, it can be recorded by anybody. Example, public servant. It cannot be said that a dying declaration recorded by a police officer is always invalid. If any dying declaration is not recorded by the competent magistrate, it is better that signatures of the witness are taken who are present at the time of recording it. Next is the features are statement is recorded by anyone, oath is not required, accused or his counsel not present, cross-examination is not done, legal value is comparatively less, admissibility not admitted but has corroborative value, nature is merely recording of statement, type of evidence is documentary, role of doctor, assess composement is record the statement in absence of magistrate, status in India followed. Moving on to the conclusion. Dying declaration is a legal concept, refers to that statement which is made by a dying person, explaining the circumstances of his death. Dying declaration is admissible on the sole ground that it was made in extremis. In India, its admissibility is explained in Section 32 of Indian Evidence Act. Thank you.
Thank you, Doctor. Next, I invite Dr. Priyanka Prakash Patil for the paper presentation. Dr. Priyanka, are you there? Hello, Dr. Priyanka Prakash Patil, are you there? Hello, Dr. Priyanka Prakash, are you there? Okay, next I invite Dr. Devyani P. Dasar for the paper presentation. Dr. Devyani, are you there?
Yes, sir.
Hello, Dr. Dev.
Yes,
Okay,
yes.
Doctor.
Is my voice is visible? Voice is audible, sir?
Voice is audible, Doctor. Voice is clear. Please share the screen, Doctor.
Yes, yes, sir. Is the screen is visible, sir?
Doctor, visible, Doctor. Please chat now.
Yeah. Thank you so much. Good evening, all. Estimation of efficacy of Agnikarma and Sandhigat Vata with special reference to Shreshmadhara Kala. Myself, Dr. Divyamol MD is going to present on this title. Having Associate Professor in Department of Shalya Tantra of Mahatma Gandhi Ayurveda College Hospital and Research Center, Wardha. So these are the case study prospectus regarding introduction, aim, objectives, methodology, follow-up, observation with the references. Introduction. So as per Acharya Sushruta, that Kala is a barrier or interface between the Dhatu and its Asha by giving examples of this Pita Foon, Snayu and Jarayu. Sandhigat Vata is Hanti Sandhigata, Sandhine Shula Show for Atopa Karo teacher. And also Vatapurna Druti Sparsha, Shota Sandhigate, and Prasarana Akunchanayo Vedana Pravritisha Savedana. And osteoarthritis regarding this correlation is non-inflammatory condition that is characteristic by progressive damage and loss of the articular cartilage with an accompanying periarticular bone response. So incidences of this osteoarthritis is 5 million people suffer from this every year, and this is the second most commonest musculoskeletal problem. So treatment available for this one is the Sneha Upakram Agni Karma with the Bandhana Mardana. In also Svedana Upanaha, like this Acharya Sushruta gave this one. According to the modern non-pharmacological reduction, thermal modalities exercise with the education, also pharmacological NSAIDs, intra-articular injection, capsicum in cream. So why Agni Karma? So according to Acharya Sushruta, Ksharat Agni Karyana Kriyasu Vakhyataha, Roganam Apunarbhavata Bheshaja Shastrakshari Asadhanam Tasadhatvascha. So study profile regarding this one is the aim estimation of efficacy of Agni Karma and Sandhigat Vata with special reference to Shleshmadhara Kara with the objective to estimate the efficacy of the same, having the selection criteria randomly irrespective of the age and the sex with the same sample size of the Sandhigat Vata, that is osteoarthritis and of knee joint with the parameters of subjective and objective pain, swelling, mobility of the joint with the objective Caligrans-Lawrence scale with the goniometer scale assessment. So scientific validation of this one is the Dochika, when this heat means transmission is going to be get transmitted in tissues. With the, it results in Dhatu Klesha and improves the Dhatu Agni. Also Anga Pachana Dosha Niramta Vata Kapha and becomes Prakrita. And when scientifically we are going to talk, then this Agni Karna stimulates the piezoelectricity of bone, releases electrical signals, and causes the oriental deposits in the lesion, which resists the deformity, prevents further damage, and coming back to the normalcy. Here, some of the complications I found while doing this procedure: hyperparexia in male patient and female patient. So here we are going to see the lesions. Now, conclusion, which already I shown in earlier slide with the scientifically and doshi. These are the references. So thank you, organizers, for giving this opportunity to me. Thank you so much.
Thank you, Doctor, for the session. Thank you, Dr. Devyani. Next, I invite Dr. Rahul Trevigan for the paper presentation on the topic Ayurvedic concept of immunity. Dr. Rahul Trevigan, are you there? Hello, Dr. Rahul Trevigan, are you there? Hello, Dr. Rahul, are you there? Priyanka Prakash Patil, are you there? Dr. Priyanka Prakash
Yes,
Patil,
sir.
are you there?
Yes, sir. Where is he? Hello.
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 The screen is visible, Doctor.
Yes, sir. Hello, good evening, everyone. Myself, Dr. Priyanka Patil, pre-MS Shala Ketantra 2020-21. My topic name is, hello.
Your voice is clear, Doctor.
Hello.
Please continue.
Yes, Ingudi Tel Karnapuran in management of Karnashul. Introduction. Shalakya Tantra is one of the major branch of Ashtanga Ayurveda. Karna Sharir, Karna Roga, and their Chikitsa has been described in Shalakya Tantra. Acharya Shushruta mentioned total 28 Karna Rogas in Uttar Tantra, and Karnashul is one of among them. Keywords: Karna Puran, Inguditel, and Karnashul. Samprapti. Due to Mithya Ahar Vihar, vitiated Kapha Pitta Rakta Dosha associating with Srotashrit Vayu moves into ear in all direction, causing severe pain, and this condition is called as Karnashul, which is difficult to treat. Symptoms. Symptoms of Karnashul are the severe pain in and around the ear. In modern science, Karnashul is correlated with diffuse otitis externa. Diffuse otitis externa, it is diffuse inflammation of meatal skin which may spread to involve pinna and epidermal layer of tympanic membrane. Clinical features: hot burning sensation in ear, otalgia, mild itching, ear start oozing thin serous discharge, which are similar symptoms present in Karnashul. So we are correlating Karnashul with diffuse otitis externa in this study. In modern science, treatment for diffuse otitis externa include ear toileting followed by medicated wicks, antibiotics, and analgesics. Whereas in Ayurveda, there are many formulations like Karnapuran, Karnadhupan, Karna Prakshalan, and internal medication has been explained. Methodology. All literary information is collected from classical Ayurveda textbook, modern Ayurvedic text, and review articles. Charak Samhita, Shushruta Samhita, Ashtang Hrudaya, Bel Samhita, Bhaishaja Ratnavali, Dhanvantari Nighuntu, Sharangdar Samhita, and internal sources, internet resources. Objective: to understand the effect of Ingudi Tel Karnapuran in Karnashul and to review the literature about diffuse otitis externa. Karnapuran. The person to whom Karnapuran is to be administered is must lying in lateral position, keeping the affected ear upward, and Swedan is to be done, and the Strota is to be filled with Sukoshna Sneha, that is Ingudi Tel. Ingredients: preparation of Ingudi Tel, Ingudi beach 1 part, Til Tel 4 part, and water 16 part. Ingudi Tel will be prepared according to the Samanya Tel Pakividhi explained in Bhaishaja Ratnavali. Disease review. Due to Mithya Ahar Vihar, vitiated Kapha Pitta Rakta Dosha associating with Shrotashrit Vayu moves into ear in all direction, causing severe pain, and this condition is called as the Karnashul, which is difficult to treat. Discussion. Karnapuran plays significant role in management of Karnashul. Result. The patient will be assessed on the basis of the subjective and objective parameters. Criteria for assessment. Subjective criteria. Karnashul, mild, moderate or severe pain. Karnakundu, no itching, mild itching, moderate itching and severe itching. Objective criteria. Karnastrav, no strav, strav after itching, strav with itching and frequent strav with itching. Second, meatal skin color, reddish skin without swelling, reddish skin color with swelling. Conclusion, the treatment is based on principle of Hetu Viparit Chikitsa, provides considerable relief in Karnashul. And here is some references. Thank you.
Thank you, Dr. Priyanka.
Thank you, sir.
Thank you for the presentation. Next, I invite Dr. Preja Vijaykumar. Dr. Preja, are you there? Dr. Sushmita Bag, are you there? Hello, Dr. Sushmita, are you there? Okay, next, Dr. Bhagyashree Shivling Kachare, are you there? Dr. Bhagyashree Shivling Kachare, are you there? Dr. Akshay Trambak Salve, are you there? Dr. Akshay Trambak Salve, are you there? Dr. Somesh Sandosh Varade, are you there? Dr. Somesh Sandosh Varade, are you there in Zoom? Soumya PT, are you there? Hello, Dr. Soumya PT, are you there? Okay, I think today's presentations seems to be over. Thank you, dear doctors, and thank you for your valuable cooperation, and thank you the panel members, and thank you team Ayurapta.
Thank you for conducting this presentation.
Thank you, doctor. And let's wind up of today's session.